Hands up on the waistline, get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses, get lost in the rhythm of me. Please don't go. Hands up on the waistline, get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses, get lost in the rhythm of me. Please don't go. Hands up on the waistline, get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses, get lost in the rhythm of me. Please don't go. Hands up on the waistline, get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses, get lost in the rhythm of me. Please don't go. Hands up on the waistline, get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses, get lost in the rhythm of me. Please don't go. Hands up on the waistline, get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses, get lost in the rhythm of me. Please don't go. Hands up on the waistline, get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses, get lost in the rhythm of me. Please don't go. Oh, get up on the dance floor tonight. I got 2 left feet and a bottle of red wine, making me feel like the beat in the bass line or in my blood. Both hands up on the waistline, get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses, get lost in the rhythm of me. Please don't pause until we wanna leave it. Up on the dance floor tonight. I got 2 left feet and a bottle of red wine, making me feel like the beat in the bass line or in my blood. Both hands up on the waistline, get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses, let's split seconds, dance in the rhythm of me. Please don't pause until we wanna leave it. Up on the dance floor tonight. I got 2 left feet and a bottle of red wine, making me feel like the beat in the bass line or in my blood. Both hands up on the waistline, get on up. Get up on the dance floor tonight. I got 2 left feet and a bottle of red wine, making me feel like the beat in the bass line or in my blood. Both hands up on the waistline, get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses, get lost in the rhythm of me. Please don't close until we wanna leave it. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes and let's pretend we're dancing in the street in Barcelona. 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 Get up on the dance floor, move. It's a Saturday night. I fell in love with the sparkle in the moonlight, reflected in your beautiful eyes. I guess that is destiny doing it right, and dance like they do in the Mediterranean. Spin you around me again and again. You're like something that God has sent me. want you, baby, solamente. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. Pretend we're dancing in the street in Barcelona. Las Ramblas, I'll meet you, we'll dance around La Sagrada Familia. Drinking sangria, mi niña, te amo Macarena. Mamacita, rica, sí, te adoro señorita. Nosotros, vive la vida, come on, let's be free in Barcelona. Las Ramblas, I'll meet you, come on and dance with me in Barcelona. Drinking sangria, I just want to be in Barcelona. Mamacita, rica, feel that summer breeze in Barcelona. Nosotros, vive la vida, siempre viva Barcelona. I got 2 left feet and a bottle of red wine, making me feel like the beat in the bass line are in my blood, both ends up on a waistline. Get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses. Get lost in the rhythm of me. Place don't close until we wanna leave it. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. 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 On the dance floor, move. It's a Saturday night. I fell in love with the sparkle in the moonlight, reflected in your beautiful eyes. I guess that is destiny doing it right. And dance like they do in the Mediterranean, spin you around me again and again. You're like something that God has sent me. I want you, baby, solamente. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. Barcelona. la vida. Come on, let's be free in Barcelona. Let's Ramblas, I'll meet you. Come on and dance with me in Barcelona. Drinking sangria, I just want to be in Barcelona. Mamacita, rica, feel that summer breeze in Barcelona. Nosotros, vive la vida, siempre viva Barcelona. Up on the dance floor tonight. I got 2 left feet and a bottle of red wine, making me feel like the beat in the bassline are in my blood, both hands up on a waistline. Get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses. Get lost in the rhythm of me. Place don't close until we wanna leave it. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes and let's pretend we're dancing in the street in Barcelona. 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 Get up on the dance floor, move. It's a Saturday night. I fell in love with the sparkle in the moonlight, reflected in your beautiful eyes. I guess that is destiny doing it right, and that's like they do in the Mediterranean. Spin you around me again and again. You're like something that God has sent me. I want you, baby, solamente. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. 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 Oh, Barcelona. So let's pretend we're dancing in the street in Barcelona. Las Ramblas, I'll meet you. We'll dance around La Sagrada Familia. Drinking sangria, mi niña, te amo Macarena. Mamacita, rica, sí, te adoro señorita. Nosotros, vive la vida. Come on, let's be free in Barcelona. Las Ramblas, I'll meet you. Come on and dance with me in Barcelona. Drinking sangria, I just want to be in Barcelona. Mamacita, rica, feel that summer breeze in Barcelona. Nosotros, vive la vida, siempre viva Barcelona. Get up on the dance floor tonight. I got 2 left feet and a bottle of red wine, making me feel like the beat in the bassline are in my blood, both hands up on a waistline. Get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses. Get lost in the rhythm of me. Place don't close until we wanna leave it. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. 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 Get up on the dance floor, move. It's a Saturday night. I fell in love with the sparkle in the moonlight, reflected in your beautiful eyes. I guess that is destiny doing it right, and that's like they do in the Mediterranean. Spin you around me again and again. You're like something a goddess sent me. I want you, baby, solamente. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. 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 Oh, Barcelona. So let's pretend we're dancing in the street in Barcelona. Las Ramblas, I'll meet you, we'll dance around La Sagrada Familia. Drinking sangria, mi niña, te amo, Macarena. Mamacita, rica, sí, te adoro, señorita. Nosotros, vive la vida. Come on, let's be free in Barcelona. Las Ramblas, I'll meet you. Come on and dance with me in Barcelona. Drinking sangria, I just want to be in Barcelona. Mamacita, rica, feel that summer breeze in Barcelona. Nosotros, vive la vida, siempre viva Barcelona. Up on the dance floor tonight. I got two left feet and a bottle of red wine, making me feel like the beat in the bassline are in my blood, both hands upon a waistline. Get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses. Get lost in the rhythm of me. Place don't close until we wanna leave it. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. 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 Get up on the dance floor, move. It's a Saturday night. I fell in love with the sparkle in the moonlight, reflected in your beautiful eyes. I guess that is destiny doing it right, and that's like they do in the Mediterranean. Spin you around me again and again. You're like something a goddess sent me. I want you, baby, solamente. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. Barcelona. Get up on the dance floor tonight. I got 2 left feet and a bottle of red wine, making me feel like the beat in the bassline are in my blood, both hands upon a waistline. Get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses. Get lost in the rhythm of me. Place don't close until we wanna leave it. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes and let's pretend we're dancing in the street in Barcelona. 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 Up on the dance floor, move. It's a Saturday night. I fell in love with the sparkle in the moonlight. Reflected in your beautiful eyes. I guess that is destiny doing it right. And dance like they do in the Mediterranean. Spin you around me again and again. You're like something that God has sent me. I want you, baby, solamente. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. 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 Oh, Barcelona. So let's pretend we're dancing in the street. Barcelona, las Ramblas, I'll meet you, we'll dance around La Sagrada Familia. Sangria, mi niña, te amo Macarena. Mamacita, rica, te adoro señorita. Nosotros, vive la vida, come on, let's be free in Barcelona. Las Ramblas, I'll meet you, come on and dance with me in Barcelona. Drinking, sangria, I just want to be in Barcelona. Feel that summer breeze in Barcelona. Nosotros, vive la vida, siempre. Viva Barcelona. Up on the dance floor tonight. I got 2 left feet and a bottle of red wine, making me feel like the beat in the bassline are in my blood, both hands upon a waistline. Get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses. Get lost in the rhythm. Place don't close until we wanna leave it. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes and let's pretend we're dancing in the street in Barcelona. 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 dance floor move. It's a Saturday night. I fell in love with the sparkle in the moonlight, reflected in your beautiful eyes. I guess that is destiny doing it right, and that's like they do in the Mediterranean. Spin you around me again and again. You're like something that God has sent me. I want you, baby, solamente. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. Barcelona, oh Barcelona. So let's pretend we're dancing in the street in Barcelona. I'll meet you, we'll dance around La Sagrada Familia, drinking sangria. Mi niña, te amo, Macarena. Mamacita, rica, sí, te adoro, señorita. Nosotros, vive la vida. Come on, let's be free in Barcelona. Las Ramblas, I'll meet you. Come on and dance with me in Barcelona. Drinking sangria, I just want to be in Barcelona. Mamacita, rica, feel that summer breeze in Barcelona. Nosotros, vive la vida. Siempre viva Barcelona. Up on the dance floor tonight. I got two left feet and a bottle of red wine. Make me feel like the beat in the bass line, or in my blood, both hands upon a waistline. Get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses. Get lost in the rhythm of me. Place don't close until we wanna leave it. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. Barcelona. On the dance floor, move. It's a Saturday night. I fell in love with the sparkle in the moonlight, reflected in your beautiful eyes. I guess that is destiny doing it right. And dance like they do in the Mediterranean, spin you around me again and again. You're like something I gotta see. Up on the dance floor tonight. I got two left feet and a bottle of red wine, making me feel like the beat in the bass line, or in my blood, both hands upon a waistline. Get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses. Get lost in the rhythm of me. Place don't close until we wanna leave it. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. 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 Get up on the dance floor, move. It's a Saturday night. I fell in love with the sparkle in the moonlight, reflected in your beautiful eyes. I guess that is destiny doing it right. And dance like they do in the Mediterranean, spin you around me again and again. You're like something I gotta send me. I want want you, baby, solamente. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. Barcelona, oh Barcelona. So let's pretend we're dancing in the street in Barcelona. Las Ramblas, I'll meet you, we'll dance around La Sagrada Familia. Drinking sangria, mi niña, te amo Macarena, mamacita rica. Te adoro, señorita. Nosotros, vive la vida. Come on, let's be free in Barcelona. Las Ramblas, I'll meet you. Come on and dance with me in Barcelona. Drinking sangria. I just want to be in Barcelona. Mamacita rica. Feel that summer breeze in Barcelona. Nosotros. Vive la vida, siempre viva Barcelona. Get up on the dance floor tonight. I got 2 left feet and a bottle of red wine, making me feel like the beat in the bassline are in my blood. Both hands up on the waistline. Get on up, baby, dance to the rhythm of the music. Don't care what the DJ chooses. Get lost in the rhythm of me. Place don't close until we wanna leave it. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona. 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 Get up on the dance floor, move. It's a Saturday night. I fell in love with the sparkle in the moonlight. Reflected in your beautiful eyes. I guess that is destiny, doing it right. And dance like they do in the Mediterranean. Spin you around me again and again. You're like something that God has sent me. I want you, baby, solamente. You and I were flying on an aeroplane tonight. We're going somewhere where the sun is shining bright. Just close your eyes. Let's pretend we're dancing in the street in Barcelona.
Good morning po sa inyong lahat. Bakit tulog pa sila? Still sleeping po ba?
Good morning po.
Or
Good
still in bed?
morning.
Good morning.
It's cold but we're up.
Ay,
Good
hi,
morning,
Ma'am
sir.
Ru from Baguio.
Yeah,
Good morning
super
po.
cold. Good morning.
We have from Visayas and Baguio. Most of are from Visayas. From Iloilo. Actually, no, there are 100 invitees. Pagtataka lang ako, ayaw nila ng free. Pag may bayad, gusto nila. Pag free, wala. But anyway, for those who have participated, we are like 20. Di ba, Ma'am Ruth, pag libre, ayaw nila.
Baka hindi po napansin. Cute lang kasi yung ano eh.
Hindi, nag-email din ako eh. May email din sila eh. But anyway, it's not my loss, it's theirs. We have two speakers, no? Si Ma'am Odette, who spoke during the advanced EBP webinar last month, and Sir Gerald Kawili. I know that you know them already, so I don't need to have a very detailed introduction of our speakers. But anyway, our advanced webinar, no, last month, no, it was accredited for 21.5 CPU units, and don't you know that that was the highest CPU units given in a webinar ever. So congratulations to the course developers of the advanced EBP webinar. So nakikita ko lang mga units ng mga one-day webinar na mga ganyan, mga 6 units, mga 8 units. But you know, magaling gumawa yung mga ating mga course developer and facilitators. So anyway, sino po yung unang speaker, Ma'am Odette or Sir Gerald?
Ako po, sir.
Hi,
Good
ma'am.
morning,
Yes,
everyone.
Yes, ma'am. You can share po yung ano niyo. Pwede na ba
Your
ma-share?
screen. Okay, wait po. Okay, before I begin sharing my screen, may I ask the participants if they have downloaded the article by Hinman? Kasi kahit libre po to, may activities po tayo. Sir Chard,
Yes, ma'am.
paki-share na lang po mamaya yung yung activity sheet. Okay?
Nakapost sa
Mamaya
ano?
po.
Nakapost
Google
sa...
Classroom po. Google Classroom, tsaka sa Google Docs. Yung mga
okay.
facilitators po, ginawa ko po silang Okay. So I hope that you have downloaded the article by Hinman because that would be our basis, no, for today's discussion. Or Imrad. Okay, let's begin. Okay, let me just wait. Just wait po tayo. Okay. So, this is supposedly a bridging program for those who will be attending the... Can you see my screen?
Yes, ma'am. Yes.
Yes, thank you. So, this is supposedly a bridging course because most of the feedback that we received during the first run of the EBP seminar, no, most of the participants commented, maganda naman daw po yung course, but the problem is, mahirap nga yung research or medyo mababa, medyo hindi po ganun kalalim, no, yung background po nila sa research to be talking about the IB, the DV, which is supposedly part of the undergrad. So we are doing this bridging course so that when you join the program, the EBP seminar on its second run, medyo meron na po tayong no. Anyway, this is just a review. Okay? Sige.
We are live in YouTube, so you can share po. Thank you.
Okay. So, when we ask question about research, what, why, who, when, where. Okay, ang pinakamahirap pong tanong is how. Okay, as professionals. Because as professionals, we already know what research is, why is research important, who needs to research, when do we research, and where do we conduct our researches. But the most difficult would be how. Okay, so according to Carter and Lubinsky, okay, there are 4 steps in developing answerable research questions. Okay, and what are these steps? Okay, so first you identify a topic, you identify what is wrong with the topic, you now choose a theoretical framework, and then lastly, you now develop your question. Okay, so the first step is to identify a research topic. Okay, the first step will always be the hardest step. Okay, but we need to take that hard step in order to move forward. So how do we identify a research topic? Ito po yung pinakamahirap. Either yung student, sobrang dami ng topics, no, na hindi niya ma-focus kung ano talaga yung gusto niya, or literally wala pa po siyang na-identify na topic. Okay, so I will be giving 2 steps, no, in identifying a research topic. There are actually many. Okay, the first one is, where do we find this research topic? We can find these research topics, no, in government and non-governmental organizations' research agenda. For example, okay, so we have the NURA, which is specific for the health researches, and your NERA, which is specific for your education researches. Now, why do we need to align our research topic on NURA or NERA? It is important that we align our research topic in this agenda because, okay, if your proposal, no, passes their standard, you might get funding. Okay? Okay. And our very own, no, physical therapy, no, we have developed this research agenda for physical therapy. But this is for the American Physical Therapy Association. I know that the PPTA is currently coming up with our very own, no, PPTA research agenda. Okay? And then when you look at this journal, makikita mo, ang dami palang topics, no, na researchable. No? So we will never run out, no, of topics, no, in terms of this research agenda. Okay? Kung ayaw mo humanap, no, ng research agenda, okay, you might want to look at the recommendations, no, or limitations, no, based on the study's limitations na kunwari gusto mo. For example, you came across an RCT. And then you become interested, no? You became interested with this RCT such that you wanted to replicate the study. Okay, the term is replicate. Okay, hindi po duplicate. Kasi bawal po ang duplication sa research, no? So ang ibig sabihin po nun, plagiarize po siya. Okay, so ibig sabihin, pwede kang tumingin ng isang RCT and then you go to the recommendations part of that RCT and then you have another article, no? Or you have another research to build on. Again, this is not duplication. This is called replication. Lalong-lalo na po sa mga estudyante, the first time I taught research, that was what I asked them to do. Hanap ka ng isang RCT that you would like to replicate. So ano po yung sinasabi ko? Because this is the easiest way of identifying a topic. Kunwari, ito po, no? I like the article by Hinman. Although this is in 2003, ito po yung lagi kong ginagamit na journal article, no, for my research class. So kunwari, ito, no? The immediate effects of adhesive tape on pain and disability in individuals with knee osteoarthritis. And this is also the journal article that we will be using, okay, for our introduction. So kunwari, instead of reading the abstract, kunwari, nakita mo yan, something in the title, no, struck you and you wanted to replicate the study. You don't go through the abstract, you don't go through the methods, you don't go through the introduction, you go straight to the limitations of the study, looking at the recommendations. So kunwari, in terms of this study, okay, they recommended larger number, no, of subjects because there were only, I think, 18 subjects, no, in this study. And then, instead of, identifying or evaluating the effect of knee taping on pain and disability, okay, so they recommended, no, that you study about the effect of knee tape on muscle output. Okay. Kunwari, ma'am, gusto ko niyan, pero ayoko ng quadriceps muscle. Okay? Kunwari, I have this journal that says that it's actually the gluteals, no? That is actually controlling the valgus varus stresses or angulation of the knee that contributes, say, for example, to the disability among patients with knee OA. Okay, then you might as well, instead of applying the tape, not to the quadriceps, apply the tape to the hamstrings o kaya to the gluteals, whatever it is that you have, okay, based on the literature review. So, ito na po yung pinakamadali, no, para mag-identify ng topic. Okay? So, you ask a student a specific RCT, no, that the patient or the student would like to replicate. When you say replicate, no, you go to the limitations of the study and then look at the recommendations, no, suggested by the authors. So dito, they wanted to change, okay, say for example, the dependent variable. So instead of measuring the immediate effects of tape on pain and disability, they recommended, no, that you measure instead, no, its effect on muscle output. Or maybe you can change, no, the taping, no, the muscles that need to be taped instead of the quadriceps, you choose another muscle. However, that has to be backed up by literature. You don't just choose any muscle. Okay? Yan. So this is by far the simplest method of identifying a research topic. So meron ka ng research topic. That is the first step. Okay? So na-identify na ng bata that the student would like to study about the immediate effects of knee taping. Okay, knee taping pa rin. Okay, pero hindi na knee disability. Gusto niya na kunwari muscle output. Kunwari quadriceps muscle output. Kaya po naka-red yan. Okay po? So ganun po siya, no? We don't duplicate, we replicate. Okay. So tapos na siya mag-identify ng topic. What is the next step? The next step is to identify what is wrong with the topic. So now we identify the problem. Okay, and this is when we start doing the IMRAD. Okay, so IMRAD stands for the intro, the method, the results, and discussion. So for this part, I will be discussing the letter I, no, the introduction. Okay, so what is the difference between the traditional and the IMRAD form, no, of thesis? For those who have undergone, no, the master's degree, no, in some universities, be it MAED, MSPT, okay, the traditional school of thought will always be the 5 or 6 chapter format. Tama po ba? Yan, no? Yan yung old school. Chapter 1 will be introduction that consists of the background of the study. Then they have their own chapter 2, which is review of literature, which is pwedeng incorporated with your introduction. You have chapter 3 that corresponds to the method. Chapter 4, no, which corresponds to the results. Chapter 5 for the discussion, and then chapter 6 for the conclusions and recommendations. So this is the traditional versus the IMRAD format. Now we are looking at the IMRAD format for both student paper, no, kasi it's publishable. Okay. Pero when we look at the student paper and a publication IMRAD, ano po yung difference or differences? Okay, parehas po sila ng content. Parehas po ng content, yung student IMRAD at saka publication ready IMRAD. Naglalay lang po ang difference dun sa introduction. Okay, so bawat institution, okay, may kanya-kanya po silang format for publication or may kanya-kanya po silang format for a thesis. Okay? But the trend now is for IMRAD. Why? Bakit IMRAD? Kasi it is readily publishable. Okay, may mga portions lang po tayo na pwedeng tanggalin sa student IMRAD to make it publication ready. Okay? Yan. If you have questions, no, later on, anytime during the discussion, you just post it, you just chat, okay? And then we'll get back to your questions later on. So we look at the student paper IMRAD introduction. Kasi yun yung sa akin. Yung letter M, which is the methods, will be discussed by Sir Je. No? Introduction lang naman to. A typical part of an introduction would consist of an introduction, a purpose of the study. The purpose of the study can actually be incorporated in the introduction. Later on, you will find it out. No? Some will have the significance of the study. Then we have the statement of the problem, the hypothesis, the scope and the limitations, the assumptions, and then the operational definition of terms. Okay, for the purpose of the IMRAD discussion, for the introduction, I will be focusing on the black parts. Okay, the introduction, the statement of the problem, the hypothesis, and the operational definition of terms. In the Google Classroom, if you noticed, I posted, no, if there are other parts of the IMRAD that you think needs to be discussed. Wala naman po nagsabi. And I assume that this is fairly easy, no? Significance of the study, the scope and limitations, and the assumptions. So we will be just focusing on the black parts of the IMRAD introduction. Okay. So how do we now do the introduction? Okay. So we have, okay, Swales model. Okay, ang tawag po noon, si Swales po, no, ang nag-author nito. He identified the CARS model. So what is the CARS model? CARS stands for an acronym. It says creating a research-based model. So that's how you do the introduction. Okay, according to the CARS model, okay, let's just go back. Sabing ganon, the components of an introduction could be a bold attempt, meaning yung sentence na yun, ikaw lang ang gumawa, and as such, you don't need any citation. Okay? Or it could be cross-reference, meaning, no, it came from previous researches. Okay? So let's see. Okay, so the CARS model involves 3 moves, no, when you do the introduction. The first one is when you establish a territory or you're looking at trends. The second move is when you establish a niche, no? Ano ba yung niche na yon? We are actually looking for issues or problems. And then the last move is to occupy that niche by giving the solution. So ano po yon? Okay. The first move is when you establish a territory. So ano po yung establish a territory? You define the characteristics, no, and the features of the area that you would like to study, no? So it's called the trends. Okay. What does it mean kapag sinabi nag-trending ka, no? Kunwari sa Facebook. Pag sinabing trending, pinag-usapan, no? Popular, no? Pag sinabi pong trend, pinag-usapan ka ngayon tapos nawala ka kinabukasan, hindi ka nag-trend. Tama? Pag sinabing trend, nag-span ng isang period of time na pinag-usapan ka. Tama po ba? Kunwari, ano po ba ang latest trend ngayon sa COVID? COVID po tayo mag-iisang taon na po tayong COVID, so trend po siya. Wala pong bansa pa, okay, or iilang bansa pala ang nakaagapay na sa COVID. Tama? Nung akala po nating nakaagapay na tayo sa COVID, biglang may bagong variants, no? Halos per bansa, no? Meron silang variants. Baka nga dito sa Philippines, meron din tayong sariling variant, hindi lang nila muna nire-release. Okay, kasi medyo mababa pa, no, o hindi pa ganun ka-advanced yung technology natin enough, no, to analyze the genome, whatnot. Okay, comparatively, hindi ko sinasabing hindi advanced, no, comparatively baka mas tayo, no, naglalag, no, compared to other countries. So that is what you call the trends. Okay, next. The next move is to establish a niche, no, by identifying the problems and the issues. So what is the difference between a problem and an issue? Okay. Okay. So sa akin, when you do the introduction, gusto ko the second move will be looking at the problems. When you say problems, it's all negative. Okay, it's all negative. Kunwari, when you talk about knee osteoarthritis and its effect on knee taping and its effect on pain and disability among elderly with knee OA, ang knee OA po is a problem kasi wala pong positive sa knee OA. Tama? The pain and disability that is a result, no, of the knee osteoarthritis are called problems. Wala pong something positive about it. Tama po ba? Or kunwari, stroke. Hindi po natin sasabihin na ano po siya, no? May positive side po ang stroke. Kasi lahat po ng stroke survivors will experience, no, varying forms of disability. Although others will claim na because of stroke, kunwari, no, mas naging close-knit family ties sila, yung mga ganon, no? But that is just, okay, sugar coating, no? What is seemingly something that is sour, no? So lahat po ng result ng isang sakit could be called problems. Bakit importante po yung problems? Kasi sa problems po, makikita po natin yung justification, no? Bakit kunwari nilagay natin, okay, bakit kunwari nilagay natin yung tape sa quadriceps and not some other muscle? Okay? Yan, dun po yon problems, lahat negative. Okay? The second, okay, in terms of establishing a niche, are called issues. Ano yung ibig sabihin ng issues? Okay, unlike your problems na puro negative, ang issues po baka may positive and negative side. Or specifically, an issue could be a blank spot or a blind spot. What is the difference between a blank and a blind spot? Pag sinabi po nating blank spot, little to nothing is known about it. Okay? If you have read the article by Hinman, okay, if you have read the article by Hinman, you will realize na meron siyang sinabi doon, no, that ang sinite niya, it was 2003 by the way, it's not recent. Sinabi niya doon na karamihan daw ng knee taping, no, the effect of knee taping was studied for patellofemoral knee OA. Patellofemoral osteoarthritis and not tibiofemoral. Tama? So that constitutes a blank spot. Ano po yung tinatawag nating blind spot? That is called a blank spot. Pag sinabi po nating blind spot, conflicting po, no, yung literature. Kunwari, if you read the article by Hinman, isa po sa mga blind spots, no, na tinitignan ni Hinman is that meron pong difference, no, ang literature about which is more effective. Is it the medial or the lateral taping technique? No? That is specific for patellofemoral OA but not tibiofemoral. So yun po yung tinatawag nating blind spot. Okay? Bakit importante po yung blank and blind spots? The blank and blind spots will justify, no, number one, the type of taping technique, why you use, okay, therapeutic versus neutral taping. That justifies why you use a specific taping technique because of that blind spot. Okay? Next. Okay? The last move is called occupying a niche, no? So simply stated, this is the objective of the study. Okay, simply stated, this is the objective of the study. And as such, kaya nga sinabi ko kanina dun sa introduction, okay, di ba sabi natin, introduction, objective of the study, statement of the problem. Okay, so kung wala kang specific na part, okay, for the objective of the study or purpose statement, kasama po siya sa introduction. That would be the last, okay, sentence, okay, of your introduction. Okay po? Sige. I hope that this is clear. Okay? So sabi po ni Carter Lubinsky and Damholt, no, looking at the issues, okay, or the problems. Sabi niya, it could be knowledge-knowledge conflict, it could be a policy-action conflict, or knowledge void. Pag sinabi pong knowledge void, wala pa pong nasusulat about it. Ang tawag po doon blank spot. Okay? Pag merong knowledge-knowledge or policy-action conflict, ang tawag po doon are blind spots. Okay, what about policy action conflict? Sinabi na natin, no, that based on the accessibility law of the Philippines, ito po yung height ng ramp for every length, no? Kung ito yung length ng ramp, dapat ito yung height ng ramp and vice versa. However, when you go, no, around the metropolis, kunwari dito lang sa NCR, wala pong sumusunod halos, no, dun sa accessibility law na yan, no? Very basic pero wala po masyadong sumusunod. Okay? A knowledge action conflict could be, kunwari, you came across an article that says hindi naman pala dapat hindi naman pala dapat cold, no, during the acute stage. Meron po mga journals kayo na nagsasabi na dapat daw hot. Okay? So dahil meron po silang conflict, no? It's now a researchable topic. Okay? Yan. So meron ka ng topic that you were able to identify kasi nakakita yung estudyante ng isang RCT na gustong-gusto niyang i-replicate. Okay? Please take note that the operative word is replicate. Pinalitan niya yung muscle o kaya pinalitan niya yung population o kaya pinalitan niya yung outcome. So nag-replicate na siya. The next one, no, is gumawa na siya ngayon ng problem identification, looking at the trends, problems, blank spots, and your blind spots. Okay? Sige. Let's try this activity, no? Naka-group na po kayo, pero parang 20 lang ata or 25 lang yung participants, excluding us. So that would be 4, no? Tama po ba? Mali na naman ako sa math. Kunwari 4 po per group. Okay, so for example, for group 1, they are supposed to identify the trends. Group 2 will be problems. Okay, group 3 will be blank spots. Okay, group 4 and 3 and 4 would be blank spots, and then group 5 would be the blind spots, including the solution. Okay? Stop ko lang yung screen share, no? Para bigyan lang natin ng ano, kasi sabi bawal daw mag-activity 2 hours lang to. I'll stop sharing my screen and then I will share now the journal article. Anybody can answer. Okay? Anybody can answer. Okay? So paano po ba yung mga blank spot, blind spots na yan? Okay, let's see. Okay? Sige, pakibasa po yung first sentence. Anybody? Miss Ruth Fernandez, pasensya na, ikaw na yung nakikita ko dito sa sa screen ko. Ma'am Ruth?
Okay. This one, ma'am. Osteoarthritis, OA,
Yes.
is prevalent worldwide, affecting 30 to 40% of people aged over 70 years.
Yan.
Stop. The
Stop.
first statement,
Okay.
yeah.
Okay. So what do you think is that first statement? Is this a trend, a problem, a blank spot, or a blind spot?
For me, like, it's a trend. Kasi prevalent.
Correct. See? Tama si ano, no? Tama si, ang tawag dyan, si Cars model, no? We begin with the trend. Bakit kaya sa palagay nyo, importante na nagsisimula yung ating introduction with a trend? Kasi it lays down the numbers, no? Imagine if 30 to 40% of people, no, are affected by NEOA, ibig sabihin, no, there is a need for it to be researched. Pag sinabi mong 0.01% of the population, no, kung naman, baka walang masyado maging interesado dyan. Tama po ba? Next. Okay, pakibasa po yung susunod na sentence. Dominic, Sir Dominic Noche. Sir Dominic. Payne. Sir Dominic, are you around? Wala po si Sir Dom.
Okay lang po. Okay po.
Sige po, Sir Dom. Payne?
Pain and physical disability are apparent in almost half of patients with radiographic disease.
Stop. Okay, so what do you think is that? Is that a trend, a problem, a blank spot, or a blind spot?
Sa akin is problem.
Correct. O, see, tama na naman pala si no? Tama na naman pala si si Cars model. So, merong problem. Check. Okay, let's see. Okay, tatawag ako, no? Nandito. Fritz? Helera? Pakibasa nga po yung inexpensive.
Inexpensive interventions with minimal side effects are desirable.
Okay, what do you think is that sentence? Is it a trend, a problem, an issue, or a solution?
Yeah, solution.
Okay. Okay, basahin natin ulit, no? Kapag sinabi po nating issue, 'di ba, may positive at saka may negative. Remember that the solution is the objective of the study. Tatandaan niyo yan. The solution will always be the objective of the study. Let's dissect the sentence. Inexpensive, minimal side effects. May positive? Yes, inexpensive. May negative? Opo, minimal side effects. So this one is an example of an issue. This one is an example of an issue. So hahanap na lang tayo sa issue na isang blank at saka blind spot. Why do you think that they have this sentence, inexpensive, minimal side effects? Bakit? Kasi that justifies the use of taping. Bakit? It is something that is inexpensive and it has minimal side effect. Bakit minimal side effect? The most that you can get in a tape is a is a skin irritation. Tama po ba? Is a skin irritation. Why do you think that they have to emphasize that that knee OA is common over 70 years old? People over 70 years old. Remember, pag 70 years old na yung mga taong yan, marami na po silang comorbidities, marami na po silang iniinom na gamot. Tama po ba? Tama po ba, Sir Fritz? Tama po? Marami na
Yes,
po
ma'am.
silang iniinom na gamot. So kung marami na silang iniinom na gamot, tapos iinom pa sila para sa pain, tama po ba? So biktima sila ng polypharmacy, no? Yun yung isa sa mga problema natin sa geriatrics. Biktima na sila ng polypharmacy. Tapos bibigyan na naman sila natin ng pain. What else? If you read between the lines, tatandaan po natin na kapag tumatanda ka na, bumabagal po no yung intestinal absorption natin, kahit nutrients man yan or gamot man yan. So dati, kung uminom ka ng gamot, ng mga bata-bata ka pa, pag uminom ka ng biogesic, maya-maya, no? Okay, hindi po ako nagpo-promote ng gamot. Okay, paracetamol. Kung uminom ka ng paracetamol, maya-maya bababa na yung lagnat mo. Tama po ba? Pero pag matanda ka na, do you think it will take effect right away? Medyo hindi na, no? Kasi ang hanap nga natin immediate effect. Naintindihan po? Naintindihan po? Check. Let's see. Sinong gusto kong sumagot, no? Gerald Orina, Sir Je Orina, pakibasa nga po yung initially developed. Sir Je Orina, are you there? Ano ba tong speaker na to? Nagtatawag talaga. Akala niya ata. School to. Okay lang yan. Sige na. Elaine? Elaine? Nawala tuloy si Elaine. Kita ko na siya kanina. Elaine, are you there? Andre? Andre?
Yes, ma'am.
Okay. Pakibasa po yung sentence na yon. Initially developed.
Initially developed to treat patellofemoral pain syndrome. Evidence suggests taping may benefit individuals with knee OA.
Okay. So is this a blank spot or a blind spot? Remember, pag sinabi nating blank, wala pa talaga. Pag sinabi nating blind, conflicting.
Blank.
Ano kaya? Blank spot. Very good. Okay, let's see. Very good, no? Okay, syempre ayoko kay Madam ba? No? Sino ba to? Burley? Ma'am Burley? Are you there? Ma'am Burley? Wala po. Let's see. Okay. Bray. Bray Acanto, are you there? Bray? Wala.
Yes.
Ayan, Bray. Bray, could you read the sentence in 14 patients? In 14 patients, ito po.
In 14 patients.
14 patients with patellofemoral.
Patellofemoral joint, OA. Krishnahan et al. Found medial patellar taping significantly reduced pain compared with mitral and lateral taping.
Okay, what do you think is that sentence? Is it a blank spot or a blind spot?
Blind spot, miss.
Very good. It's a blind spot, meaning one knee taping technique was significantly better than the other. And this is actually the reason why they use therapeutic taping. Tama po ba? Sabing ganon, medial. No? So it was applied medially and therapeutically with tension. So that justified why they used therapeutic taping. Tama? Okay, let's see. Very good, no? Gusto ko yan. Dominic Garucho, no? Na-miss namin to during the orientation kahapon. Pakibasa, although encouraging. Garucho. Dom Garucho.
Hello po. Okay.
Yes, good morning.
Although encouraging, further investigation must verify these findings before taping is accepted as a valid treatment for knee osteoarthritis.
Okay, is it a blank spot or a blind spot?
Blind spot po.
Okay, pwede siyang blind spot pero technically pwede siyang blank spot kasi para sa knee OA. Tama? Kapag may mga ganong, although encouraging further investigations, yung mga ganyan, pag sinabing further investigations, ibig sabihin blind spot yan. Blank spot yan. Okay? Sige. Tingnan natin, bakit kaya sa quadriceps nilagay yung tape? Bakit kaya sa quadriceps nilagay yung tape? Okay, basa. Okay. Sige. Eleni, are you there? Wala. Jacqueline? Yes, Nak. Pakibasa. Improved?
Improved quadriceps force, knee joint kinematics, and onset timing of the vasti have been noted in the population.
Okay, check. Naintindihan po kung bakit sa quadriceps nilagay yung tape? Kasi ito po yung action daw, no, ng tape, no, when they applied it on this muscle. However, remember that this study was based on patellofemoral OA and not for knee OA. Tama po ba? Check. And then last, no, Miss Jacqueline, could you read our aim? Miss Jacqueline? Are you there? Miss Jacqueline? Wala si Miss Jacqueline. John Michael. Our
aim was to compare pain and observe disability in individuals with symptomatic generalized knee OA under 3 conditions. Untape, a therapeutic taping protocol designed to alter patellar alignment and unload the infrapatellar fat pad, and a neutral taping protocol designed to provide sensory input only.
Okay, so is that a trend, a problem, an issue, or a solution? Nak, sir pala. Ano kaya yon? So dahil nakalagay our aim, so that is already the solution. That is already the objective of the study. Ganun. Okay po ba yon? Okay po ba yon? So totoo po ba si Carr's model of introduction? Opo. So totoo po yung Carr's model of introduction. You're actually supposed to be group, no? In 5. So dahil hindi na po kayo nakagrupo ng ganon, o di okay na po to. Okay po? So kunwari kung 25 po kayo or 20 na lang po kayo, so magiging 4 na lang po, no, per group. Kasi you need to have this activity, no, accomplished. So tapos na tayo sa introduction, no? So we already established the trends, the problems, the blank spots, the blind spots, and the solution, which is the objective of the study. Okay. So now, meron pa po bang gumagamit ng statement of the problem? Okay? Kasi parang ang perception ko po, kaya po ito nilagay, is para dun sa mga kailangan mag-develop, tama po ba, ng research program or ng research parang internship, no, as part of their research, or maybe for the teachers handling the research. So now we go to the statement of the problem. We're looking at the deep questions, no? Specifically, among the deep questions, ang kailangan lang po natin hindi lumabas, okay, the DE, no, the descriptive and the exploratory questions. Mamaya titingnan natin. Ano po ba yung descriptive, exploratory, explanatory, at predictive questions? Okay. So have you heard about simulacrum? Okay, narinig nyo na po ba yung term na simulacrum? John Philip Abenir? John Philip, have you come across the term simulacrum? Sir? Oo. Is this the first time? Okay, raise po ng hands yung first time nakarinig ng simulacrum. Ayan, syempre hindi ko naman nakikita. Okay. Okay, so what is a simulacrum? What is a simulacrum? Okay, according to Webster, okay, according to Merriam-Webster, no, a simulacrum, ang plural daw niya is simulacra or simulacrums, is an image or a representation. It is an image or representation, no? So how do we now know what this research simulacrum is? Okay? So when you say research simulacrum, okay, I will cite an article. Hindi po sa akin to. This is a Philippine author, no? So eto po, no? So ito po yung simulacrum niya, okay? Pero ang title po niya ay, ang tawag niya po ay research paradigm. So ngayon po sa publication ready, dati po ang tawag sa kanya research paradigm, no? So ngayon po ang mas updated version niyan, no? Ang tawag na po sa kanya ay research simulacrum. So a research paradigm, no, when you look at the research paradigm according to this one, shows the relationships of the variables. If you look at the paradigm, no, nandoon yung independent, okay, tsaka dependent variable. So that is basically a research simulacrum. A research simulacrum is a figure, okay, illustrating the relationships of the variables studied, no, in your research. Okay? So yan. So klaro po 'yon. Dati research paradigm, ngayon po ang tawag na po sa kanya ay research simulacrum. Okay, dahil doon, okay, let's look at what is a variable. No? Kapag sinabi po nating variable, no, very clear naman po. It is a characteristic or an attribute that can vary. Kunwari, among the participants, kung lahat po kayo babae, is it a variable? Magiging variable pa rin ba yon kung lahat ng attendees natin ay babae? Jovic? May sumasagot, pasensya na, hindi ko naaano yung chat ha. Variable pa rin po ba yun? Hindi na.
No,
hindi
miss.
na. Correct, very good. Pero kunwari, yung age ng participants ngayon na, what do you think? Jovic? Will it be a variable?
Yes, miss.
Correct. Yung kanyang
Yes, miss.
practice setting, will it still be a variable? Practice setting, academician, clinician, variable pa rin yun?
Yes, miss.
Correct. Okay, may mga nagchat-chat. Pasensya na, hindi po ako nagbu-multitask, no? Kapag tumatanders ka na, bumababa po ang ano mo, no? Ang multitasking capability mo. So, yun po yung tinatawag nating variable. Kapag hindi po pare-parehas, ang tawag po doon ay variable. So there are at least 3 types of variables. Marami pa pong ibang tawag dyan, no? Continuous, no? Discrete. Pero yung pong continuous and discrete para po yung sa statistics. Okay, in terms of the simulacrum, there are 3 types of variables that can be illustrated in a simulacrum. So you have your independent, dependent, and your confounding variables. Okay. So let's see. Okay, pag sinabi po nating independent variable, this is the treatment variable. Kunwari, stretching. Dito po sa article natin, ang variable po dito is taping. Tama po ba? This is manipulated by the researcher. Pag sinabi pong manipulated by the researcher, parang negative po ang connotation. Pero ang totoo lang po nun, kaya po sinabing manipulated by the researcher, kasi the researcher can now see, okay, or can now ask, or opt to have, kunwari, strengthening, and then endurance, and then, okay, a placebo exercise, no, for a specific group or the control group. Okay, your independent variable may have levels, kagaya nito. Okay, comparison of stretching, strengthening, and endurance exercises on neck pain and disability. Ilang levels kaya meron ang example na to? Ilang levels kaya meron ang example na to? Kia ba to? Miss Kia, ilan po kayang levels meron? Level or levels, yung example na to? Wala si Kia. Si Jude ang susunod. Ma'am Jude, edu ba? Ilang level or levels meron ang example na to ng independent variable? Ma'am Jude? Tama ba? Judith, edu ba? Ma'am Jude, are you there? Nakamute ka po. Okay, nasa CR siguro. Ma'am Christine Montemayor. Ma'am Christine Montemayor, ilang kayang IV or IVs meron yung title na to? Comparison of stretching, strengthening, and endurance exercises on neck pain and disability.
3 po.
3.
Ay, joke.
Okay. Ganito po yan. If you look at stretching, strengthening, tsaka endurance, anong common sa kanila? May common denominator ba? Ano yung general term about stretching, strengthening, and endurance? Lahat po sila ay what? Exercises. Correct. So technically, you only have one IV with 3 levels. Ma'am, paano po namin malalaman na kung yung title po or yung research po, isa lang yung IV with different levels? Kapag tinignan mo sila at parang may common denominator sila, most likely isa lang po ang IV with different levels. Gaya niyan, lahat sila exercises. Yung isa stretching, yung isa strengthening, tsaka yung isa endurance. So you only have one IV with 3 levels. Kunwari, ang example po natin, comparison of TENS, hot moist pack, and stretching on neck pain and disability. Ilang IV or IVs meron tayo? TENS,
Dalawa na
hot
po.
packs, correct. Ay, ano ba sabi ko? Wait, TENS,
TENS, hot packs,
hot packs,
exercise.
Okay, is there any common denominator, Mr. Dominic? Meron po bang common denominator dun sa tatlo?
Yung
Meaning
first two po, physical agents, saka yung
Correct.
last one is exercise na.
Correct. So, hindi po sila common. Tama? Wala pong common denominator sa kanila. So, technically, you actually have two IVs. Tama po ba? Kunwari, nilagay ko, Sir Dom, brief intense tense, acupuncture-like tense, and placebo tense. Ilang IV or IVs meron po ako, Sir Dom?
Isa na lang po.
Isa. Naintindihan? Why is it important that you know the level or levels of IV or how many levels at that or how many IVs do you have, no? Because the independent variable will determine your inferential statistics later on. Ayoko po yung sinasabi ng mga statistician na mga ano naman yung mga allied health professionals naman yan, hindi nila alam yan, no? Ayoko po ng ganon, no? Ayaw po nating namamanipulate po tayo ng ang tawag dito ng statistician. For those who have gone through their master's degree, okay, ako po, victim po ako niya, no? Yung unang statistician na pinuntahan ko, kinumpute niya lang pong ganyan, hindi naman po in-explain sa akin. Okay? Yan. Kahit yung sinabi ko, hindi po ako dapat mag-ano. Okay, dapat po ang ginamit ko po dapat is t-test. Hindi po dapat ganito sabi nung statistician, mag-ano ka no, Cruz-Calwalis. Wala na ako nagawa. Okay, so importante po na tayo bilang researcher, meron po tayong common knowledge or at least basic knowledge about statistics para hindi po tayo ang tawag doon, namamanipulate no ng statistician kasi minsan hindi naman alam ng statistician yung mga IVs na to. Ikaw po yung mag-explain sa kanya. Okay? Klaro po yon. The independent variable, pag may common denominator po sila, most likely isang IV lang yan with different levels. Pag iba-iba po, no, yung mga variables na yan, wala pong common denominator, you most likely have different numbers of IV. Klaro po ba? Kasi the number and the levels of your IV will later on determine your inferential statistics. Okay. Sige. Sino yung una kong tinawag? Okay, let's see. Dom, ikaw na lang kasi ikaw yung nasa screen ko. Ilang IV or IVs meron ang Hinman? Dom?
Yung NEOA po yun, di ba?
Po.
Sorry po ma'am, wala pa po kasi sa Google Classroom yung...
Anak ng... Okay, sige.
Oo.
Sino po? Any volunteer? Any volunteer? Yes, sagot.
Ano po? Pain and disability, ma'am. Knee pain and disability.
Hindi. Ano ba to? IV Jude. Ilang IV or IVs meron ng knee taping na yon? Yung article by Hinman.
1, 2, 3. Tatlo po, neutral,
Correct.
therapeutic, and no taping used. Yes.
Correct. So you only have one IV with 3 levels. Check. Okay? Yan. Very good. So ganun po siya. Kaya po tayo nagkaroon ng bridging program kasi nung first run po nung EBP, pati yung statistics may problema, no? Ano ba yung between tsaka within group? O iba pa yun nak ha. Ito is determining lang. Okay, one of the parameters no for choosing a statistical test is the number of IB or IVs and the level. Iba pa po kung ilang grupo sila. Okay po, very good. Next. Okay. The other one is called, remember that the simulacrum says it is a graphic representation of the variables in the study, no? The relationships and all that. The next concept is called dependent variable. Pag sinabi po nating dependent variable, the outcome, kung ano po yung sinukat. Okay, kung ano po yung sinukat. Okay, so for example, if you want to measure the effect of GPS, no, gentle passive stretching on ROM, kung ang sinukat po ay yung ROM, then most likely that is your DV or your outcome. Tama po ba? Okay, what is important about the dependent variable? Pwede po bang 3, 4, 5? Opo, ang isang research na dependent variables, opo, pwede po. However, ang pinaka-importante pong malaman natin sa dependent variable is its level of measurement. Bakit? Yung level of measurement po ng dependent variable will also determine later on no, your descriptive, associational, and inferential statistics. Why? For a parametric test in an inferential statistics, if the level of measurement of your dependent variable is at the level of ordinal or nominal, then you cannot use a parametric test. Importante po ito sa ating bilang physical therapist kasi pag dumaan na po sa statistician yung study natin, wala na po tayong nagagawa. Si statistician, basta numero, automatic, inferential yan, parametric lahat yan. No? Kunwari, kinode mo yung mild, moderate, severe as 1, 2, 3, 4. Numero agad yan. Kukomputing niya yan as parametric. Okay po? Sige, let's see. Okay, sige. Sino na lang ang gustong sumagot? Maria Brenda. Okay. What do you think, okay, is or are the studies dependent variable or variables? Brenda? Wala si Miss Brenda. Marietta? Marietta, are you around?
Ma'am, wala
Yes.
po akong copy ng Hinman kasi.
Ay, walang copy. O sa mga susunod na pagkakataon, no? Kailangan kapag ka-in-upload. Sige, Ma'am Jude. Ano po ang dependent variables? Ano po sinukat?
Yung pain, yung effect po ng tape sa pain at saka sa disability po.
Correct, no? So we're looking at pain and disability. The pain was measured using VAS. Tama po ba? Ma'am Jude?
Yes,
on a
ma'am.
10 cm VAS. So what do you think is the level of measurement of the VAS being a centimeter?
Ordinal po.
Okay. Kung cm po yan, meron pong meron na pong journal na nagsasabi niyan, no? Ang VAS daw, hindi po daw siya dapat tinitit as ratio. Dapat tinitit daw po siya as interval. Sabi. So interval po yan. And then the other variable, dependent variables of the study includes observed disability as measured by the step test, the tag test, and the walking speed. Tama? The step test, the tag test, and the walking speed. At lahat ng ito po ay ratio. Klaro po? Ratio po yan. Importante po yan kasi mamaya may basic stat. Okay? Okay. Another type of variable that can be illustrated in a simulacrum is what you call a confounding variable. What is a confounding variable? The confounding variable directly affects your IV and indirectly affects your DV. Baliktad. Directly affects your DV and indirectly your DV. Okay? Kunwari, pareha po silang basketball player. Pareha po silang nag-stretching ng hamstring. Pero yung isa babae, yung isa lalaki. Do you think magiging iba po yung effect ng stretching given na babae siya o kaya lalaki yung participant? Pero kayang effect yon? Meron kayang effect yung pareho silang basketball player? Okay, sabi ni Jude, oo daw. 'Di ba? Kasi mas flexible na ang babae to begin with kaysa sa lalaki. So in short, the confounding variables may pertain to the participants' characteristics or simply, these are the variables no, na kino-consider natin na risk factor. Risk factor either ng disease or risk factor for the DV. Okay po? Sige. Let's see. Okay. Si group 3, 4, and 5, sabing ganon, okay, you identify now the confounding variables of the study. Okay, sabing ganon, you identify each level of measurement. Meron pong 10 confounding variables no, na kinonsider. Okay, yung researchers. Give me one. Rene, Ong. Rene. Rebecca, any? Saan po ba nahanap yon? We look at the journal article and find no, the characteristics of the participants that were considered by the researchers. Okay, let me stop sharing and then I'll share the journal article. Okay, so saan na po natin makikita yon? Malamang nandito na po yun sa bandang methods. Okay, una, sabing ganon. Okay, una, pakibasa. Anybody, pakibasa. 18? Hello po, anybody?
Ito, 18 participants with NEOA were recruited by advertisers.
Dom, pakibasa yung nasa parentheses. Importante to.
18 participants, 12 female and 6 male with
Okay, what is the first variable? What is the first confounding variable in that particular sentence? Po. Correct, gender. O, ikaw na rin, no? Ikaw na rin dyan, no? Basa, mean?
Mean? In standard deviation were age, height, weight, and body mass index of the participant.
Stop. So, ilan yon? Pang ilan na yon, Dom? So, meron na tayong sex. Sunod?
Age, height, weight, and body mass index.
So, 5 na. Check. Next. Basa, all?
All but one reported bilateral knee symptoms.
Pang 6. So, ano po yon, no? Yung laterality ng affected knee. Check. Next, the most?
The most painful knee was tested with a non-dominant leg in 72%.
So, sunod, leg dominance. Tama po ba? Next, basa, the WOMAC?
The Western Ontario and McMaster University's Osteoarthritis Index, or WOMAC, evaluated the mean or the knee pain with possible scores ranging from 0 to 20, stiffness ranging from 0 to 8, and function with a range of 0 to 68.
Stop. So, ibig sabihin, kinuha nila si WOMAC for pain, stiffness, and function. So, next, let's see. 44%. 44%, Dom?
44% of participants were graded as mild or grade 1 and 2, and 56% as severe with grade 3 and 4.
Correct. So, anong ibig sabihin? Yung NEOA severity was also part of the confounding variables. Tama po ba, Mr. Dom? So, yun po yung 12, yun po yung 10 na confounding variables no, na tinake into consideration ng mga researchers. Okay? So, kompleto na po tayo. Meron na po tayong confounding variables. Yung sinabi po ni Dom, 10 po yun. Ang outcomes po natin are pain and disability. And our IV is taping. No tape, therapeutic, and neutral tape. Okay, so very good. No? Yan, stop share. Let me go back to my PowerPoint presentation. Okay. So madali lang, di ba? Oh, yan. Madali lang naman. Okay. So again, when we look at the simulacrum, other than meron kang IV, DV, tsaka CVs, we now look at the arrows. Importante po ba yung arrows sa simulacrum? Opo. Bakit? Okay. Anong klaseng arrow yan? Anong klaseng arrow yan? Siyempre,
unidirectional po.
Correct, unidirectional. When you see a unidirectional arrow, ang sinasabi po niyan, ito po ay cause and effect, no? Relationship. Tama? Cause and effect relationship. Okay, in the first arrow, okay, alin dito yung cause, alin dito yung effect? Siyempre yung cause, eto ngayon yung effect. Tama po ba? In the second arrow, this now becomes the cause and this now becomes the effect. Tama po ba? Klaro po? The direction of the arrow signifies kung saan po siya nagsimula, yun po yung cause. Kung saan po siya tumuro, yun po yung effect. Kung saan po yung mula ng arrow, that is the independent variable. Kung saan po siya tumuro, yun po ang dependent variable. Yun po ang sinukat. Okay? So, ibig sabihin, sa research simulacrum, the arrows will already tell you, okay, what you are looking for. So, dito, ang hanap natin ay cause and effect. Okay po? Why? Because the arrows will also tell you kung anong statistical test mamaya ang gagamitin. Okay, let's see. Okay? Pwede rin po ba siyang differences? Opo. Pag gusto mo mag-compare, okay? Pag gusto mo mag-compare, ay differences po yon. Pero kung isa lang po yung IV mo at isa lang din po yung level, ang hanap mo lang ay effect. Pero kung halimbawa isa yung IV mo pero tatlo yung levels, ang hanap mo na ay differences. Naintindihan po? Magiging iba po kasi kapag ka-effect lang at saka difference ang hinahanap natin mamaya sa statistics. Okay. Next. Okay. Ano pong klaseng arrow tong mga to? Ano pong arrow yan? Kung may unidirectional ka, meron kang DOM. Anong tawag dyan sa arrows na yan?
Multidirectional po.
Oo, or bi-directional arrow, no? Bi-directional arrow. Pag bi-directional arrow, anong ibig sabihin ng bi-directional arrow? Pasensya po sa mga nagchat-chat ha. Okay, kasi hindi po ako nakakapag-multitask. Okay, pag sinabi po nating bi-directional arrow, okay, ang hanap po natin ay relasyon. Tama? Ang hanap po natin ay relasyon. So, ibig sabihin, pag nakita natin yung mga arrow sa simulacrum, alam na po natin mamaya yung tanong at alam na rin po natin most likely ang statistics. Kasi we begin by identifying the variables, its level of measurement, and then looking at the arrows to determine ano ba yung hinahanap natin. Relasyon ba yan, effect, or differences? Klaro po? O ayan, no? Research na nagsabi na ang isang relasyon is a two-way street, no? It's a give and take relationship. No? Give and take. Pag relasyon po, ang hanap natin, wala pong cause and effect. Okay, ulit po. Pag relasyon po, ang hanap natin, no? Wala pong cause and effect yon. Wala pong IVDV. Klaro po? Equal po sila. Okay po? Equal po sila dapat. Okay? Yan, no? Simulacrum na nagsabi niyan. Okay. The next one is we look at the behaviors of the variable. Kanina, is it unidirectional or bidirectional? Pag unidirectional, effect or differences. Pag bidirectional, relasyon. Tama po ba? Now we're looking at the behaviors of the variable. Looking at the plus or the minus sign. The plus sign does not say okay, the presence of. Pag sinabi po ng plus, magi-increase. Okay, magi-increase or magi-improve. For example, if we look at this one, okay, parang sinasabi po that the local support, no, via SEF expenditure will increase the quality, the access, and efficiency of basic education. And when you increase daw this access, magi-increase din po, no, yung school effectiveness. Naintindihan po? Pag positive po, hindi po niya sinasabi na present. Ang sinasabi po ni positive, magi-increase or magi-improve. Okay po? Check. Next. Ayan. A behavior could also be, kagaya nito, negative. Tama? So, anong sinasabi na to? Anong effect ng 10 sa pain? Ano po kaya ang effect ng 10 sa pain? Looking at a negative behavior, Ma'am Jude. Ano kaya yon? Ano kaya sinasabi? Negative behavior.
Tense decreases the pain.
Correct. Okay, tatandaan po kung saan po tumuro yung arrow, siya po yung magbe-bear ng sign. Okay? So tens pointing towards pain. So the negative here will be pain, no? So ibig sabihin, okay, nasa na yon? Okay, tens will reduce pain. Tama? Check. Next. Paano ito? Paano ito? Ilang IV or IVs meron ako? Dito. Ilan?
Isa po.
Anybody? Isa. Ilang level or levels, Ma'am Ruth?
3, ma'am.
Very good. So, ano daw mangyayari sa pain pag binagyan mo nitong tens?
May pagkakaiba po siguro yung pag-decrease ng pain.
Very good. Very good. Kasi ang hanap natin ay letter D, differences. Naintindihan? So, tama po si Ma'am Ruth. One of these three types of tens will reduce pain better or best. Tama po ba? Naintindihan po? So, ibig sabihin, sa isang simulacrum, the positive sign, pag effect or differences siya, ang magbi-bear po ng sign will be the dependent variable. Pag plus, ibig sabihin magi-increase or magi-improve. Pag negative po, dapat magre-reduce or magde-deteriorate. Tama? Yan. Pag isa lang po, we're looking at effect. Pag differences po, then may isa sa kanila ang best, no, in reducing pain. Check. Paano po pagrelasyon? Okay? Ma'am Christine, ano pong ibig sabihin na negative ang relasyon ni IQ tsaka EQ? Ma'am Christine, relasyon. Aha. Siyempre siya lang nakikita ako. Sabi ni Ma'am Christine, lagi na lang ako. O, anybody na lang. Negative daw yung relasyon.
Walang relationship with?
No, negative relationship. Ano ibig sabihin ng negative relationship?
Hello, ma'am. May I answer?
Yes, Ma'am Jacqueline. Sige, Ma'am
It doesn't mean that if you have a high IQ, you will also have a high EQ or vice versa.
Correct. Other way of saying it is that pag sinabing negative ang relasyon, pag mataas yung isa, mababa yung isa. Tama po ba?
Indirect relationship po.
Yes. Ang direct relationship is positive. Ito kasi negative eh. So anong ibig sabihin ng negative relationship? Pag mataas yung isa, bumababa yung isa. Tama? Yun ang negative relationship. Tama po? Check. Relasyon. Next. Okay. Ito naman. Ano naman to, Ma'am Jacqueline? Positive relationship.
The study time will always affect your academic performance. So pag nag-aaral ka, ibig sabihin there will be improvement in your academic performance.
Positive. So pag madami kang time, correct. Pag mataas ang time mo, sa study time mo, mas tumataas din ang iyong academic performance. Tama po ba?
Yes.
Klaro po. Very good. So kanina sa effect and differences, kung saan po nakaturo, yun po yung magbe-bear ng sign. Tumataas, bumababa. Tama po ba? Pero pag relasyon po, dahil wala pong cause and effect relationship, pag sinabi po nating positive relationship, sabay silang tumataas. Tama po ba? Pag sinabi po nating negative relationship, yung isa tumataas, yung isa bumababa. Tama po ba? Tama po ba? And the best type of relationship is to be in a positive relationship. Sabay kayong pumapasa o kaya sabay kayong bumabagsak. At least sabay pa rin kayong gagraduate. Tama po ba? Naintindihan po? Ayan po ang ibig sabihin ng relasyon. May nagchat-chat. Nako, naloloka ako. Hugot. Sino tong mga hugot-hugot na to? Si Jude. Ayan, no? Siyempre, malapit na Valentine's, no? Ma'am Jude. Gusto mo ikaw lang masaya. Ayan. So now, no? If we are to create our simulacrum based on the article by Hinman, the first box will be all about the CVs. Sabi ni Dom, 10 po yun. Tama? The second column contains 2 boxes. One is for pain and the other one is for your observed disability. And then the last box will now be your IV. Tama? Sige. Ma'am Jude, ano kaya sa palagay mo ang arrows na nagko-connect kay CV at saka kay DV? Ano kayang hanap nila? Ma'am Jude, edo ba?
CV tsaka DV, ma'am?
CV sa tsaka DV.
Ano po? Bidirectional, ma'am.
Bidirectional arrow. What about the IB to the DV?
Uni, ma'am, pero galing kay
Unidirectional.
IV, papunta kay DV.
Okay, very good. Okay. So simply stated, ganito po ang itsura niyan. Okay, so these are the 10 confounding variables that were considered by Hinman, and these are the 2 variables, no? Dependent variables considered by Hinman, and this is your DV, and this is your IV. So we're looking at relationship. Okay, kinuha din niya po yung relationship, and then we're looking at D for differences. Okay po? Bakit nilagay po dyan male, female, years, keme-keme? Kasi pagdating po ng statistics, that will also tell you kung anong gagamitin. Mean, median, mode ba yan? Chi-square ba yan? Pearson-Spearman? Or is it, okay, is it kung between group to? Or within group to? Is it a Kruskal-Wallis, between group? So this would be either repeated measures, ANOVA, or Friedman test. So this is how you look at the simulacrum. Okay po. Sige, next. So now you have the simulacrum. It's now time, okay, to formulate your statement of the problem looking at the deep questions. Again, sa statement of the problem po, ang hanap lang po natin are descriptive and exploratory questions. We're not after explanatory and predictive questions. And later on, marirealize nyo kung bakit. Okay. So what are the deep questions? So you're looking at descriptive, exploratory, explanatory, hindi po natin tinatanong yan, and then the predictive questions. Okay. The first type of question in a simulacrum is called descriptive question. Hindi po siya nanghihingi ng relasyon, effect, or differences. Okay. How do you know that this is a descriptive question? You look for the number of boxes, and that corresponds to the number of your descriptive questions, except the IV. Kasi given na yung IV eh. Tama po ba? And then, because you asked for descriptive questions, okay, you asked for descriptive questions, then that question will be analyzed using descriptive statistics. Okay? So, ang una pong tinatanong sa statement of the problem are descriptive questions. Tama? Sige nga po. Ma'am Jude, could you state one descriptive question in this simulacrum?
What is the level of knee pain experienced by the respondents or participants?
Check. Yan. Okay. Okay. Isa pa po. Isa pa pong descriptive. The number of boxes except the IV. Ano pa kaya?
Level of observed disability.
Okay,
and then
check.
yung lahat po ng characteristics po ng respondents. Yung
Correct.
confounding variables.
Correct. So you have 1, 2, 3. Okay? Ang simulacrum po binabasa from left to right, top to bottom. So if I were to formulate my statement of the problem, I will state my SOP number 1 as the descriptives of your CV, SOP number 2 as descriptive of pain, and then SOP number 3 would be observed disability, such that my SOP number 1 will be, what are the characteristics of the subject in terms of sex, age, height, weight, affected BMI, blah, 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 until NEOA severity. My SOP number 2 would be, what is the subject's level of knee pain? My SOP number 3 would be, what is the subject's level of observed disability? Naintindihan po? So, tatlo po yun. Okay. The next one is called exploratory. Pag sinabi na po nating exploratory, ang hinihingi na po natin ay relationship, effects, or differences. Okay. So how do you know how many exploratory SOP questions, okay, are there in the study? You look for the number of arrows. Okay, you look for the number of arrows, and that will tell you the number of exploratory questions that you have. Okay? Exploratory. Sige, let's see. Sige, iba naman. Who would like to volunteer? Walang tamang sagot. Ay, may tamang sagot, pero pwedeng magkamali. Okay? Sino po? Sino pong gusto mag-try?
Ma'am, try.
Jack? Check. Okay. So, di ba meron na tayong SOP number 1, 2, and 3. The SOP number 4, eto na po, no? Si H1. Anong hanap natin dito, Ma'am Jacqueline?
What are the differences of pain with regards to sex, age?
Pwede. Pero ang hanap kasi natin, look at the arrows. Anong hanap natin? Bidirectional. So, ano hanap?
Yung relationship po ng sex at saka knee
Correct.
pain, age tsaka knee
Correct.
pain, height and knee pain,
Correct.
ganon.
Correct. Tama. So, pwede ba natin, collectively, what do you think are these variables? Sex, age, height, weight. Kasi ang dadami ang SOP natin kapag isa-isa natin
Profile
state.
po.
Correct. Pwedeng ganon. So, simply stated, your fourth SOP could appear something like, what is the relationship between the subjects,
profile and knee pain.
check. SOP number 4, Ma'am Jack, nandun ka na rin naman.
What is the relationship of the profile of the subjects and observed disability?
Very good. O, nandun ka na rin naman, ma'am.
What is the relationship of the knee pain, between knee pain and observed disability?
Very good. See? Next, meron pa tayong H4. Anybody? Ayoko na po kay Ma'am Jackie. Tapos na siya sa relationship. Who would like to try?
Ako po.
Okay, sige. Try. Anong hanap natin? H4. Relasyon, effect, differences.
Effect po.
Oops, ulit. Relasyon, effect, differences.
Effect po.
Ulit. Relasyon, effect, or differences?
Differences.
Differences. Very good. O sige, could you state? Okay, the next question. What is?
Ma'am
What
Audrey,
is?
ako.
Ay, anak ng tokwa. O, Sir Je, ikaw na. Hindi ko nakikita kasi lahat ng participants. Sige, Sir Je, ano kaya yan? Di ba differences? Kasi nagko-compare tayo, therapeutic at saka neutral tape. Okay? So, the next question would be, what is the difference between neutral and therapeutic taping effects, therapeutic taping's effect on knee pain? Okay? O kaya, what is the difference between therapeutic and neutral taping's effect on observed disability? Okay? O sige, balikan natin yung mga sinaunang tanong. No, yung mga old school. Is there a statistically significant difference between therapeutic taping and neutral taping in terms of pain? May mga ganon, naaalala nyo pa yon? Sino po yung mga ganon? Yung mga unang panahon, ganon po ang tanong. Diba? May mga ganon.
Meron po. Meron po.
Oh, diba? Alam niyo yan. Is there a significant relationship between anak ng tokwa? Yun po yung mga old school.
Is there any difference on the profile between experimental group and control
group? Yun po yung mga sinaunang panahon. I remember when I was new, okay, ako yung youngest dun sa graduate school. So I have this first set of, ang tawag dito, advices. Specifically si Sir ang pinakauna ang alay ko po si Sir Je Kawili. Nagulat po kami na mga ganun ang tanungan. Is there a statistically significant relationship? Malamang. Okay, ayaw po nila nung ganun kasi old school. And syempre, dahil ikaw yung new, you have to what? You have to adapt kasi yun yung nila yung po yung kultura nila hindi ka naman pwedeng mag-go against the tide. Tama? And I remember Sir Je being my first advisee to defend the final thesis. Naloka ako no? Sabing ganun ng isang panelist, I believe that this is IMRAD format. Malamang IMRAD, pero 5 chapter format pa rin kami. Pero yung discussion kasi parang naka-IMRAD form, ayaw nila nung ganun. And now they're looking at a publication ready report. Nakakaloka, di ba? Minsan kasi when you're new, mahirap, ang dami mong kailangan patunayan. Yan, okay. Ayun, looking back. Okay, so tama po yon. So ganun po ang statement of the problem. We're looking at descriptive and exploratory questions. Okay? Remember, your type of questions will also determine your statistics later on. Okay? Nanghingi ka ng relasyon, so dapat relasyon ang hahanapin natin. Naghingi ka ng effect or differences. Okay? malamang, no, ang hanap mo ay inferential stats. Okay? So the next type of question, hindi na po natin tatanungin yung explanatory questions, are predictive questions. Ang predictive question is like your exploratory questions, only this time may direction. Only this time, may direction, no, as indicated by the plus or the minus sign. However, in your statement of the problem, the predictive questions have to be avoided because of, mamaya titignan natin sa hypothesis. Okay. Tama? If these were exploratory question, you will just ask, what is the effect of tense on pain? Tama po ba? Dalawa eh. If this is predictive, the question will be like, will tense reduce pain? Tama po ba? Kasi predictive eh. Kanina, in terms of exploratory questions, you just ask, what is the effect of tense on pain? Pag sinabi mong predictive, dahil may negative na, will tense reduce pain? Tama po ba? Yan. O kaya ito, will acupuncture like tense reduce pain better than brief intense tense and placebo tense? Kasi we're looking at differences. Tama? Or, is there a negative relationship between EQ and IQ? Kapag ka-exploratory yan, is there a relationship between IQ and EQ lang? Pag ginawa mo siyang predictive, isasama mo yung direction ng relationship. Okay? And we don't include this, no, in predictive. We don't include predictive questions in the statement of the problem. Mamaya titignan natin sa hypothesis bakit. Okay? Okay, if we ask this in a predictive way, we say, or we ask, is there a positive relationship between study time and academic performance? Okay po, so yun po yung predictive. Sinasama na po natin yung behavior ng variables. Okay? And we don't ask that in the statement of the problem. Ideally, dapat exploratory, walang direction. Mamaya makikita po natin bakit kaya ganun sa hypothesis. Okay na po? So again, when you look at the statement of the problem, you first ask the descriptive questions before the exploratory. Okay, the order of the questions is read from top to bottom, left to right. Kaya lahat muna ng descriptives, lahat ng relasyon, and then lahat ng effect or differences. Klaro po? Yan. That completes your statement of the problem. Okay, next. Okay na yan, no? Sinabi na natin yan kanina. Okay, next. Yan. So, ano po yung significance ng simulacrum sa theoretical framework? Okay. When you say theoretical framework, it is a lens through which you view the problem of interest. Okay? So yung isang simulacrum po, hindi po siya porket CVs, DB, IB, automatic yun na yun. Meron po kayong pinaghuhugutan, no? Meron po kayong theoretical basis or theoretical foundation for building your simulacrum. Okay, when you do the simulacrum, its theoretical framework may be based on one or two, no, theories, concepts, or principles, and even laws. Okay, it is usually what you prefer based on your interest, education, or what is promising. Okay, for example, I'm very fond of the transactional model of human performance and the ICF model of disablement. So, paano po natin gagawin yon? Kunwari, okay, I have here a simulacrum. Okay, so I'm looking at the person, task, and environment, no, factors that contribute to low back pain and disability. Okay, if I'm looking at the person, task, environment, okay, model, then I'm actually using the PTE or the transactional model of human performance. Okay po? Hindi po yan, basta CB, sabi ni Ma'am OJ, CB muna, tapos DB, tapos IB. Hindi po. Meron pong pinanghuhugutan yung mga variables na yan. Meron pong theoretical foundation kung bakit yan po ang pinili ninyong mga variables. It cannot be haphazard. It has to be based on a theoretical foundation or a model o kaya a law or a principle. Okay, what else? Okay, I'm looking at the task factors. Okay, I'm looking at the task factors like posture, load, repetition, and duration. And this is based on Barr and Barb's concept, no, of the development of musculoskeletal disorders, the development of work-related musculoskeletal disorders, no, looking at the task factors. Okay, according to this diagram, the task factors would include repetition, posture, duration, and force. Kaya nga, okay, when I go back, ito yung aking task factors. So yung simulacrum ko or yung research paradigm ko were anchored after two models or concepts. The first one is the transactional model of human performance, looking at the person, task, and environment factors that contributes to low back pain and disability. And then specifically, for the posture, load, repetition, and duration, it was based on the bar and barbs concept, no? Schematic diagram for the development of your work-related musculoskeletal disorders. Klaro po? At syempre, ang all-time favorite natin na ICF model. Ang dami pong gamit ang ICF model, no? Para po sa inyong researches. Diba? Nahihirapan yung mga bata mag-identify. Ano ba theoretical foundation nitong LINTEC na research na to? Ay, bawal pala yun, no? Naka-YouTube pala tayo. Ano po bang na mahirap talaga pagbaklaan, teacher? Ano po bang theoretical foundation? The very basic ICF can actually be used to conceptualize, no, your research paradigm or your simulacrum. Okay. So the next one is called the hypothesis, no, using the simulacrum ulit. Okay. So when you say hypothesis, okay, or hypothesis, it is an educated guess, no? It is actually a hunch about the possible outcome of your research that may postulate what will happen, no? So when you say hypothesis, no, it states now either the relationship, effects, or differences, no, between variables. Okay. Sige, anybody who can create a hypothesis about tense and pain? Educated guess, no? Lahat tayo, tapos na tayo ng electro. Ano kaya? What is your hypothesis?
Pwede pa maka-answer po.
Sige po. Sir Dom.
There is no difference between the pain levels of there is no difference for
Wait, Dom. Ano kaya hanap natin dito? Effect or look at the arrow. Is this
effect po pala?
Effect lang yan. Kasi isa lang siya. Sige, what is your educated guess about the effect of tense on pain?
There's no significant effect of tense on pain levels.
Pwede rin. Pero ikaw, tapos ka na ng electro, what do you think will happen to your pain if you apply tense? Educated guess. Tense will?
Magde-decrease po yung pain.
Correct. So that is your educated guess, no? Alam natin that tense, okay, so alam natin that tense will reduce pain. Tama po ba? Check. Bakit po sabi natin effect? Kasi po wala naman pong levels yung tense. Sinabi lang tense and pain. Check. Okay. So there are two types of hypothesis. You have the null and then the alternative. Okay? You have the null and the alternative. Pag sinabi po nating null, walang relasyon, walang effect, or walang differences. Tama? Sige, Sir Dom, pakilagay nga yung null hypothesis nito. Walang effect, walang
tense
difference.
Will not reduce pain po.
Okay, so that's predictive. Ulit.
Okay.
Tense has null, no?
Tense has no effect
on
pain.
Check. Yun yung null. Okay, check. Pag sinabi po nating alternative, an alternative is your working hypothesis. Okay, it could be one-tailed pag directional, and it could be two-tailed pag walang direction. Okay, how do we now state our hypothesis? Okay, it's better to state it in a two-tailed manner rather than a one-tailed manner to avoid type 1 or type 2 research error. Okay, anybody who knows the difference between type 1 or type 2 research error? Two-tailed po tayo. Bakit po kailangan two-tailed? Ano pong difference ni one-tailed sa two-tailed? Kasi how we stated our hypothesis, the p-values will also determine, whether we stated our hypothesis in a one-tailed or a two-tailed alternative manner. Okay, let's see. Okay. Dito, ang null hypothesis, tama po ba, Sir Dom? Sabi natin, tense has no significant effect on pain. Yun yung null. Tama? Yun yung null. Yung one-tailed, alam mo na yung direction. Tense will reduce pain. Tama po ba? Check. Pag sinabi nating two-tailed, walang direction, sasabihin lang natin, tense will change the level of pain. And this is important because we want to avoid type 1 or type 2 research error. So ano pong ibig sabihin? Siyempre, ayaw nating maubos yung neurons natin. We'll look at type 2 research error. Ang null natin, tense has no effect on pain. Tama po ba? Ang alternative one-tailed natin, tense will reduce pain. Tama? Check. Kunwari kung ang pretest mo, ang pain was 0. Ang pain mo was 9. Tama? 8 na lang. Ang tense mo is, ang pain mo using the VAS is 8. Tama? Ang null mo ulit, sabi mo, tense has no effect on pain. Ang one-tailed mo, sabi mo, tense will reduce pain. Tama? So, nung pre-test, ang pain niya, 7. Nung post-test, okay, ang pain niya, naging 10. So, ano nangyari sa pain? Bumaba, tumaas? Bumaba, tumaas? Tumaas. So dahil tumaas siya, we will now reject the one-tailed hypothesis, which is tense will reduce pain, and we will accept the null hypothesis, which is tense has no effect on pain. Tama po ba na tanggapin that tense has no effect on pain?
Hindi po.
Hindi. Tama. So dahil doon, nakakommit ka ng type 2 research error. You accepted the null hypothesis to be true when it is in fact false. Bakit? Kasi mali po yung one-tailed hypothesis. Sabi mo kasi magre-reduce. Nag-increase. Tama? So kapag ka ganon, i-reject mo yung alternative hypothesis mo and then you will accept the null hypothesis. Naintindihan po? Kaya we don't ask predictive questions. We don't state our null hypothesis in a one-tailed manner. Kasi we are more likely to commit type 1 or type 2 research error. Naintindihan po yon? Usually po, depende po sa institution. Kunwari sa amin, ang gusto lang itanong is null hypothesis. Sa ibang institution po, meron po bang nagre-require na mag-state ng one-tailed or two-tailed hypothesis? Anybody?
Null din po kami dito.
Null lang. Very good. No? Pwedeng ganun. Okay po? Pero, even if your institution requires you to just state the null hypothesis, okay, it is important that you have an alternative hypothesis that is stated in a two-tailed manner. Okay po? So yung kanina sabi natin, ang null natin, tense has no effect on pain. Ang one-tailed mo, sinabi mo, tense will reduce pain. Pero instead na nag-reduce, nag-increase yung pain. Kasi one direction na lang, one-tailed yung hypothesis mo eh. So ngayon, i-reject mo yung one-tailed, i-accept mo yung null, which is false. So type 2 research error. Naintindihan po? Kaya po siguro, null hypothesis lang ang ini-state. Pero when you do have an alternative hypothesis, it has to be stated in a two-tailed manner. Okay? Bakit importante na two-tailed? Para ma-avoid po natin yung type 1 or type 2 research error. Plus, the one-tailed or the two-tailed hypothesis will determine the p-value later on in your hypothesis. Okay po? Sige, let's see. Okay. Pwede pong paki-state yung hypothesis, null hypothesis nitong second example. Anong hanap? Relasyon, effect, difference?
Relationship po.
Okay, sige. Null hypothesis, Dom.
There's no relationship between your EQ and AQ po.
Check. What about one-tailed? What do you think is the relationship between EQ? You know what AQ is? AQ is adversity quotient. Yun na daw po ang importante, hindi ang EQ ngayon. Dom, what do you think is the relationship if you look at the one-tailed? Is it positive or negative?
Negative po.
Okay, sige. Sige. One-tailed alternative hypothesis, Dom. EQ?
EQ has a negative relationship with AQ.
Very good. What if you state it in a two-tailed manner?
EQ has Wait lang po.
Has?
EQ has
Tatanggalin mo lang yung
significant differences.
No. Sabi natin, relasyon, di ba? Tatanggalin mo lang yung plus minus, yung negative
significant
positive.
relationship po has
Very
with
good.
AQ. EQ has a
Very
significant
good.
relationship with AQ.
Very good. Klaro po yon. So depending on your institution, you might want, depending on the institution, either null hypothesis lang, or if your institution also requires you to do an alternative hypothesis, you have to make sure that it is stated in a two-tailed manner. Okay? And the two-tailed statement of your hypothesis determines also the p-value. Kasi pag nag-generate ka ng statistics, kunwari for relationship and differences, meron pong 1 tsaka two-tailed na p-value. So, alin po doon yung kukunin. So, depende po kung paano nyo in-state yung alternative hypothesis. Okay. Check. So, paano na ngayon to when we look at our simulacrum? So, the simulacrum, we use this, number 1, for your statement of the problem, and we're looking at the simulacrum now to formulate your hypothesis. Okay, the number of arrows will determine the number of hypotheses. Okay? So, ilang hypotheses ang ma-generate natin out of this simulacrum? Ilan po? Ilan po? Anybody?
5.
5. Very good. Very good. Ilang relasyon na hypothesis ang ma-generate natin?
3 po.
3. Ilang differences na hypothesis ang ma-generate natin?
2.
Very good. Next. Okay. Ano po kaya ang una nating hypothesis? Null. H1. Null. Anybody? H1? Yes, Jude. Si Jude po muna.
There's no relationship between the subject's profile and level and knee pain. Level of knee pain.
Check. H2. Dom?
There is no relationship between the profile of the subjects with the observed disability.
Check. Next, H3. H3? Jude?
There is no significant relationship between the level of knee pain and observed disability.
Check. Next, H4. We're looking for differences. Okay. Sa pag-differences, ano kaya yun? Paano kaya state yung differences na hypothesis?
There is no significant differences.
Very good. Between
the effect of neutral and therapeutic on knee pain.
Very good. Ma'am Ruth, observed disability naman.
There is no significant differences between neutral taping and therapeutic taping on the observed disability. On the level.
Very good. Very good. See? Okay na po. Okay na po yung hypothesis natin. Yan. Okay. So sabi nga null lang naman. So kapag pinakreate po kayo ng alternative hypothesis, okay, then it has to be stated in a two-tailed manner. Okay? Check. Okay na yan, hypothesis. Okay. And then the last one is called your operational definition of terms, Okay. Wala po akong kasalanan Dapat hanggang 10:30 ako kasi late tayo nag-start. Okay? We're now looking at operational definition of terms. Okay. What is the significance of operational definition of terms, or simply the operational definition of terms? Okay, when you look at the simulacrum, or when you look at the title of a study, okay, at least the major terms in the title has to be defined, Okay, not just conceptually or the textbook definition, but more importantly, operationally, define it. Okay? Bakit kailangan po nating i-define yung terms sa study? So we know the context by which the study was made. For example, if you look at the ICF model, asan po doon magpo-fall yung disability? Anybody? If you look at the ICF model, alin po din yung disability level? Is it the body structure? Is it the activity? Is it the participation? Is it the person? Or is it the environment? Anybody?
Participation po.
Very good, no? Participation. Tama? So, ikaw, Dom, ano-ano ba yung participation level na nakikita natin sa ICF?
Community, work.
Very good. Very good. Ano pa?
School.
Very good.
Family.
Yan. So, ibig sabihin, kapag sinabi kong observe disability, iisipin ni Dom na yun yung mga mineasure ng tape. Kasi technically speaking, when you say disability, it has to be at the level of the participation restriction. So that includes work, ADL, play, school, and leisure. Tama po ba? Tama po ba? Pero pag binasa mo yung yung article ni Hinman, wala doon, ni isa doon yung tinatawag niyang disability level. Naintindihan po? Kasi depende po kung paano po, okay, kinontextualize yung mga terms sa study. Tama? Kunwari, ano bang ibig sabihin ng taping? Anybody, ano po ba yung taping? Sino po nag-manual therapy dito? Ano po ba ibig sabihin ng taping? Kunwari, gumamit ako ng, ang tawag dito, scotch tape. O kaya masking tape. Taping po ba yon? Will it be considered taping? Pwede ba yon, Ma'am Jude? Ay, yung mga amaten po. Pwede, see? Pero yung po ba yung ginamit? Yung po ba yung ginamit sa study? Hindi po. Naintindihan po, kaya importante po, okay, that we define our terms not only conceptually, but more importantly, operationally. Ang tanong, paano po ba dinedefine operationally ang terms? Okay, let's look at this example. Okay. Pakibasa po yung first definition ng blood pressure, yung nasa left. Anybody? Yes, Ruth?
Blood pressure, the pressure exerted by the blood as it passes through an artery.
Yan. Is this a conceptual or an operational definition sa palagay mo, Ma'am Ruth?
Conceptual po.
Concept, no? Kasi this is a textbook definition. Next, how do we operationally define, kunwari, blood pressure? We operationally define it based on how we measure the blood pressure. Pakibasa po yung second, Ma'am Ruth.
The ratio of systolic blood pressure over diastolic blood pressure as measured by a standard and aneroid sphygmomanometer.
Okay, so that is now the operational definition. Check. Naintindihan po, magkaiba po ngayon yung ano nila, magkaiba po yung, ang tawag dito, naging magkaiba po yung definition ng blood pressure. Depende kung define mo ba siya operationally or contextually. Okay, when we define a term, no, contextually or conceptually, it is defined based on the book definition. But when we define a term operationally, it is defined based on, okay, how it was measured. Tama po ba? Sa inyo pong institution, Ma'am Ruth, ano po ang hinihingi? Operational or conceptual definition?
Most likely both po. Depende po kasi sa how they will parang present their topic, kung ano yung mga keywords po nila.
Oo. So technically, ayun, tama po si Ma'am Ruth, no? At the very least, okay, yung IVDV, no, has to be operationally defined, or operationally and conceptually defined, no, in the study. Kasi yung po ang pinaka-importante, saka na lang po yung iba. Okay, so paano po ba natin kinukuha or ginagawa yung operational definition? Yung conceptual, madali na yan, no? Sa libro lang yan. Tama na yon, period na yon. Okay, so paano po natin dinedefine yung major terms sa study ng isang estudyante? Okay, first we look at the disease. Ano po ba ang disease dito sa Hinman? Ano po ang disease natin dito? This is called
osteoarthritis.
Very good. So how do we define operationally knee osteoarthritis? We define it based on the diagnostic. We define it based on the diagnostic criteria. Okay? Naandyan po ba yung diagnostic criteria ng knee OA sa journal? Okay po? Nandiyan po ba? Opo. Let me just stop sharing my screen and then I'll go to your... O pasensya na po sa mga nagchat-chat ha. Alam niyo ang mga thunders, medyo mahirap na po yung mag-multitask, no? Okay, can you see? Can you see? Yan. Okay. Asan po dito yung operational definition ng NEOA based on the diagnostic criteria? Basa, diagnosis, anybody? Diagnosis?
Diagnosis was based on the American College of Rheumatology clinical and radiological criteria.
Stop, Dom. Ano dyan yung clinical criteria?
Yung American College of...
alin dyan? Dyan sa criteria na yan. Ano dyan yung clinical criteria?
Yung knee pain po on most days of the previous month.
How do you know that you have knee pain using the VAS?
Yung average pain po of greater than 3 cm on a 10 cm visual analog scale. Very good.
See, ang knee pain doon, okay, using the VAS will be defined as a score of greater than 3 cm. So kung ang score niya ay 2, hindi siya kasali sa study. That is the clinical criteria. Tama? What about the radiological criteria, Dom?
Osteophytes po on any radiographic view.
Okay, very good. Kasi they use the Kellgren-Lawrence criteria. Remember, if you look at the Kellgren-Lawrence criteria, ang tinitingnan po doon, the presence or absence of osteophyte and knee joint space narrowing. Tama po ba? Tama po ba? So, una po yung osteophyte. Tama? Sunod yung joint space narrowing. Tama po. So, at the very least, dapat meron kang osteophyte. Tama. Is it possible, Dom, na nauna yung joint space narrowing bago yung osteophyte formation sa Kellgren-Lawrence criteria?
Sorry po, hindi ko na po maalala.
Ayun na nga. Yun na nga, no? Next week ko pa kasi topic yan. Ayun, no? Naintindihan po. So that is the clinical or that is the operational definition of knee osteoarthritis based on the American College of Rheumatology. So, dapat po daw dalawa. If you look at the diagnostic criteria, mas mataas po yung sensitivity tsaka specificity ng clinical and radiologic criteria kaysa clinical alone or radiologic criteria alone. If you look at the tree, no? Yon, no? Yung diagnostic tree ng OA. Naintindihan? So, that is how you define. That is how you define, okay, a disease operationally. You define it based on the clinical, okay, based on the diagnostic criteria. Kasi if you define it conceptually, knee OA is a degenerative blah, blah, blah. Yun ang conceptual definition. But operationally, it can be defined based on the diagnostic criteria. Check. Next. No? Sa susunod, ha, mag-open na kayo ng mga ano nyo, no? Ng mga journals ninyo para hindi tayo ganun-ganon. Okay, next. The DV will be defined, okay, based on the outcome measures. Okay, so kunwari, sinabi na natin kanina, yung knee pain or pain in itself was measured using the VAS. And according to the operational definition, dapat ang score mo is greater than 3 cm. Tama po ba? Para masabi na may pain ka. Tama? And the IV will be defined based on its procedure, no? Kung paano po siya in-apply. Tama po? So, meron pa po kasi tayong isang DV dito. Tama? And DV, the other DV is called observed disability. Remember, sabi ni Dom kanina, if you look at the ICF framework, the disability will be defined based on the participation restriction in terms of work, play, school, leisure, and maybe even ADL. Pero dito po, iba po ang pagkaka-define nila ng knee disability. Tama? Knee disability was defined based on step test, tag test, and walking speed. Tama po ba? Okay. Kakastiguhin po ba natin yung mga authors for not knowing what disability is? Hindi po. Kasi yun po yung ano nila eh. Yun po yung framework nila for the disability. Okay. Let me ask. Okay. What will define disability in terms of walking speed? Anybody? Paano mo i-define ang disability based on walking speed? Pag mabagal o mabilis?
Decrease.
Correct, no? Kapag mas mabagal ang walking speed mo, ibig sabihin may disability ka. What about tag test? Paano mo malalaman na may disability ka in terms of tag test? Anybody?
Meron pong
Timed up and go test.
Meron pong given time for
Very
tag
good.
test.
Very good. O yan, no? Alam yan dito. May mga cut-off scores kasi yan, no? Para masabi natin na may disability. And remember that the test can be predictive or can be descriptive or evaluative. Kapag ginamit natin yung tag test to describe the level of, kunwari, disability, iba po yung cut-off score. So, kunwari, ang cut-off score is 20. Kunwari lang, pag greater than 20, disabled ka na nun. Tama? So sa walking speed, kunwari ang typical, kunwari lang ha, kunwari ang typical walking speed ng isang elderly na may knee osteoarthritis is kunwari lang 20 meters per second. That constitutes disability. Okay? Yan. O kaya mas mababa pa doon ang nalalakad niya. Yun po ang disability. Okay? Next, how do we define disability in terms of the step test? Anybody dun sa journal, step test? Kapag mas marami kang nagagawang steps in 45 seconds or kapag mas konti ang steps na nagagawa mo in 45 seconds? Sa palagay nyo?
Pag mas konti po.
Very good. Naintindihan po? Ibig sabihin ang dependent variable, hindi po siya mas mataas, mas pangit. Hindi po lahat ng mataas maganda, no? Pag mataas ang presyo ng baboy dito sa Metro Manila, pangit po 'yon. Tama? At hindi po lahat ng mababa, no, maganda. Tama? Pag mababa ang sweldo, pangit po 'yon. Tama po ba? Naintindihan po? So you have to look at the outcome. Paano po siya ini-interpret? Hindi lahat ng tumataas ang score, gumaganda. At hindi lahat ng bumababa ang score, pumapangit. Kagaya ng tag test. Okay, pag mas mababa ang score mo sa tag test, better po yon. Walking speed. Pag mababa po ang walking speed mo, meters per second, kunwari in seconds lang, o di mas maganda po yon. Pero kapag meters per second, pag mas mataas po yon, mas maganda. Okay? And then, how do we define the IV? We define it based on how it was used in the study. Okay, so we look at the procedure. Okay, so we look at the procedure. Okay, let's see. Okay. Kunwari, let's look at knee pain. So yung pain using the VAS, alam na natin. Ilan nga daw? Ilan nga daw po? Anong score mo dapat sa VAS? Dapat? More than?
Greater than 3 cm.
3 cm. Check.
Of the 10 cm.
Una, how do we now complete the operational definition of pain? Knee pain. Una, we define pain. What is pain? Pain is an unpleasant sensation. Sensation po ang pain. So it is an unpleasant sensation. Next, we define what are the boundaries of your knee. Ano po ba yung boundaries ng knee natin? Kapag ka nasa likuran, knee pa rin ba yan? Pag nasa popliteal area, knee pain pa rin ba yan? Knee pa rin ba yan?
Yes, ma'am.
Okay. Sa OA, is it typical to have popliteal pain? Di ba usually anterior lang yan, no? Nasa harap, wala masyadong popliteal. So how do we now define knee pain? Okay, kunwari, ang knee boundaries, kunwari lang wala akong literature dito, baka sabihin, ay, pala definition ng knee, no? Yung mga nagtuturo ng anatomy dyan, kunwari lang. We define the boundaries of the knee as the area between the distal third of your femur to the proximal third of your tibia. Kunwari yun ang boundaries ng knee. Tama? Ang pain po sa knee osteoarthritis, is it located anteriorly? Yes. Could it also be located medially? Yes. Could it be located medyo laterally pero anterior pa din? Pwede. Tama po ba? Check. Kung may pain ako pero hindi secondary sa knee OA, kunwari meniscal, ligamentous o kaya traumatic, Will that constitute knee pain? Dito sa study nila? Siyempre hindi na kasi dapat ang kailangan natin is knee OA. So now, when we complete the operational definition of knee pain, so that would be an unpleasant sensation felt, no, from the distal third of your femur to the proximal third of your tibia, anteriorly, laterally, and medially, secondary to knee osteoarthritis. It is a pain greater than 3 cm in a 10 cm VAS. That completes the operational definition of your knee pain. Klaro po? Okay po? Klaro po yon? Yan. So yan po yung groupings ninyo. Okay, yung knee OA na define na po natin kanina. Okay, so ang gagawin po ng group 1 other than knee OA, ano pang gusto nyong i-define dyan?
Disability, ma'am.
Ayoko na ng disability. Ano na lang? Knee OA severity. Meron na din therapeutic taping. Ano na lang?
Neutral taping po.
Meron na din. Ano na lang? Elderly. Okay, so group 1, elderly kasi tapos yung knee OA. Okay po? Yan. So, tapos ka na ng topic, tapos ka na ng problem, tapos ka na ng theoretical framework. Okay, it's time to develop your research question. Pero yung sa totoo, tapos ka na ng research question nung umpisa pa lang, no? When you define or develop your research question, you use, no, the PICO. So, for example, in this study, no, the P, okay, the population being studied or the problem being studied is knee osteoarthritis. The intervention was therapeutic taping compared to neutral taping, and the outcome was pain and disability. Okay, so when you formulate, kunwari, a thesis proposal, okay, for this study, you say a comparison between neutral and therapeutic taping's effect on pain and disability among community-dwelling elderly with knee osteoarthritis. Paki-define po group 1, community-dwelling elderly, no? Community-dwelling elderly po, group 1. Okay po? So that ends my talk. Okay, tama 10:15. So ibig sabihin tama po ako, 2 hours po tayo dahil 2 hours lang po ang allotted sa akin. I hope that you did learn something from my talk this morning. Okay, and on behalf of the Phil Australian, I would like to invite you, no, to attend, no, the advanced EBP course, no, evidence-based physical therapy, no, practice, no, seminar that will be on, I think this is March, no, 7 and 14, not to know more. Kasi this is what we noticed during the first run. Hindi naman po kasi pwedeng ilagay lang natin review. Hindi po pwedeng gano'n kasi wala pong points yon, no, sa CPD kapag ka-review. Remember that this is an advanced course dapat, no? So tapos na po kayo sa competence, dapat advanced competence na tayo going towards expert. Hindi po nila bibigyan ng points kapag review. And then we realized that among the participants themselves, they were honest enough to admit na hindi naman po ganun kaganda kasi yung foundation nila sa research. And so we identified, no, that they should have been part, no, of the course prior to attending the advanced EBP. Alam na natin yung IDBB, alam na natin yung, kunwari, yung, ang tawag dito, yung statistics, kasi hindi alam nung participants last time kung tama ba yung statistics na ginamit o hindi. So I hope you did learn something from the talk this morning. And if you want to know more, no, you can always attend, no, the course by Phil Australian. Okay, that ends my presentation for today. If you have any questions, paano po ang questions sila, Sir Sir Chard, mamaya?
Yes, ma'am, or they can post sa Google Classroom natin.
Sa Google Classroom na lang. Sa Google Classroom na lang kasi magtutalk po si Sir Je. Okay po? That ends my report. I hope to see you Okay, I hope to see you sa ano natin, no, sa seminar po natin. Okay po? Thank you po.
Thank you, ma'am. So the next speaker is Sir Gerald Kawili.
Good morning po. Allow me po to share my screen.
Yeah.
Sir, nakikita na?
Yes, yes.
Okay, this is design po. This is design. Majority naman po is was given introduction by Ma'am Audrey a while ago. So this is a research method and design, and the basic is statistics. Okay, so this is the part of the appraising literature. So the components would be 1 to 12. It was discussed the study purpose in the literature. So my part here is the result and the design. How we could interpret, looking at how could interpret the result, looking at the different tables, figures, or even dummy tables and dummy figures kapag proposal writing. Okay, so the result might be on a statistical language and data analysis. Okay, so to give you a brief introduction on the parts of the manuscript in the old school style, okay, the problem and its background, ito po yung component. So naka-imrad na po ito. So naka-imrad na po siya. So we have the introduction, the methods, results, and discussion. And some of the school is adapting this kind of manuscript format already, that the review of literature is after the introduction. And then what Ma'am Ozzy have discussed a while ago, yan po yung mga, nandyan po yung mga nandito po sa left side. Okay? And if we look at on the right side, the methodology of the study, it contains the methods and technique use, locale of the study, the population and sampling instrumentation, data gathering, procedure, method of statistical analysis, and potential ethical considerations. But of course, we look into today the methods and statistics only. Okay, so when we look at the design, we have two major designs. So that is qualitative and quantitative. And under your qualitative research design, we have document. So this is a study of documentary accounts of events such as meeting. Okay. If we look at qualitative research design, we look into the beliefs, experiences, attitude, behaviors, and interactions of our participants. Actually, we call them not participants, not respondents in qualitative research. We call them as uh, co-investigators. Okay, so we have also the passive observation, talking about systematic watching of behavior and talk in natural occurring circumstances. So, yung researcher po dito will going to immerse in a community at i-observe lang po niya and nagja-jot down lang po siya through field notes. Okay. The participant's observation is the observation in which the researcher also occupies a role in that particular setting. So, pwede po yung researcher ay magpapa-adapt po siya sa isang pamilya, sa isang community, at i-observe po niya yung customs and traditions. Pwede po na ganon. Sa atin po sa health, in public health, pwede pong gamitin iyon. So you, taking for example, if you are going to immerse in one community at titignan mo po yung mga health beliefs, traditions, uh, health practices po nila, uh, magpapa-adapt ka in a one family, and you will look at to their practices, health practices. So in-depth interview naman po is you will have to face-to-face conversation. So meron na po itong interaction with the community people. And then the last one would be the focus group discussion. You gather some 7 to 12 person. Actually, yung 12 po is madami na daw po iyon. And then you will going to ask a major question. What are the beliefs, practices, customs, traditions on health, or somewhat, as of the moment, COVID-19, communicable diseases of the community. So we might want to look into that. And then we arrive at themes, direct quotations. We classify the direct quotations into themes and then characterize them, cluster them, and we arrive at uh, we arrive not a conclusion but theoretical saturations. And majority of qualitative studies are being done in social sciences. Okay, so we have also the quantitative studies which generate numerical data or data that can be converted into numbers. So we have the case report. It is a single patient, okay, or a single survivor, because as ethics uh, inhibit us to use patients already in our manuscript, rather survivors po. Okay? And we have also the case series. It's a report on a series of patients without a control. And we have the case control studies. So yung case report po isang pasyente. Yung case series, madami na pong pasyente ito, pero wala pong control. Okay? So, tinitignan lamang po natin yung effect. Okay? Your case control study identify patient with particular outcomes or yung mga exposed, compared it to the non-exposed patients or people. And we have the cohort studies identify two groups of patient, one which received exposure. Meron na po itong experimental group and control group. Follow these cohorts forward for the outcome of interest. Okay? So, when we look at other key quantitative studies, we have the randomized control trial, which is the gold standard for experimental research design. And we have the reviews, systematic reviews, and meta-analysis. Okay? We have also the cross-sectional survey. Ito po yung non-experimental research design. Pwede po iyon yung DV kanina, and in its relationship to the confounding variables, pwede po siyang cross-sectional studies. Okay? So, yung sa Hinman na example ni ma'am, kung titignan po natin yung, i-determine po natin yung descriptive, that's one already. So, that's epidemiological studies. Okay? So, ilan yung nagkakaroon ng sino ang mas prevalent na magkaroon ng osteoarthritis? Is it the male or the female? Okay? So, kino-compare po natin siya. So, we look into epidemiological studies. What are the age group na pwede pong magkaroon ng knee osteoarthritis? Okay? So, pwede pong yun. Determinants of the demographic profile. So, descriptive. Pag kinorelate po natin siya, correlational din po iyon. Okay? So, yun po. Alright. So, the features of a true experimental research design would have the manipulation, or meron po tayong IV or independent variable, or the intervention or the treatment. We have the control group, or meron tayong experimental group and control group, and we have the randomization. So random assignment, random selection, and random assignment. So any violation to to these features will fall under the quasi-experimental research design, which I believe the quasi-experimental, if you let me go back, ito po siya. Okay? And if we look into without intervention or manipulation, that is the descriptive research design. All right. So if we look into evidence-based practice also, RCT is the most commonly used methods of research design to justify what we are doing to our patient for interventional studies like your RCT. Kung wala pong RCT, we go down to cohorts. Kung wala pong cohorts, we go down to case control, then case series. Okay? Pag diagnosis naman po, yung mga outcome measure natin, it is a prospective blind comparison to the gold standard. So ngayon po, madaming gumagawa po niyan kasi pandemic, especially graduate school, they will going to adapt outcome measure, translate it to even undergrad. Okay, the English version will be translated to the Ilocano version, Tagalog version, or to the native dialect. Tapos titignan po nila yung validity, reliability of that particular outcome measure. Okay? And then the prognosis, cohort study, case control, case series. Pwede po yun. Harm, pwede po tayong mag-start on the RCT, cohorts, case control, and case series. Okay. So much on that. Meron din po tayong critical appraisal or user's guide to evidence. You have the primary studies and the integrative studies na qualified po siya as far as EBP is concerned. Okay? So, primary studies, nag-undergo po siya ng implementation. The integrative studies are compilation analysis of previous studies from the primary studies. All right. So, in the evidence-based paradigm, syempre, malakas po ngayon ay vaccine. Saan po nag-umpisa yung vaccine? Okay? It came from animal research, pwede po siya, in vitro, in vivo, okay, ideas, opinions, editorial, nagkaroon po ng generation of academic guess or intellectual guess or hypothesis. You test those hypotheses, okay, and then we go on the case report. Iisang pasyente, implement po natin yung intervention na yon. Kasi there is an itching of the head or itching of the mind. So, effective siya sa animal, baka pwede rin po sa tao. No? So, we go on up to the level of RCT. Okay? So, finding the highest strength of evidence available to answer your clinical question might be the RCT or the systematic review or meta-analysis. Okay? When we look at the classifications as far as primary research and secondary research, we have this one. So your primary studies would from randomized control trial, cohort studies, case control studies, case series, and case report. And if we go on to the secondary researches, ito na po yung i-compile yung mga result and i-analyze. No, systematic reviews, meta-analysis, up to the level of evidence-based guidelines. So parang ano po to, madami po sa baba hanggang pataas ang pataas, kumukonti na po sila. Parang PT lang po. Marami sila pag first year, kumukonti na po sila hanggang fourth year to fifth year. Okay. So this is now the method of statistical analysis. Okay? Nandito po ata yung nakahanap ng journal na example ko sa ating webinar. Nandito po si Sir Dominic. Siya po nakahanap nung gagamitin kong journal. Okay? Nung 203 ba, Sir Dominic? Nakahanap siya. Okay, descriptive statistics would be your mean, median, mode, standard deviation. Of course, we have level of measurement na dapat nasa mean. Okay? Meron din po tayong level of measurement na nasa median. Meron din po tayong level of measurement sa mode. Actually, mean, standard deviation are partners. So tinitignan po kasi natin yung dispersion kapag tinatawag na standard deviation. So kung titignan nyo po, itong etong ano na to, curve na to, if this is the curve, okay? If this is the curve, okay? Titignan nyo po, the mean is here. Okay? The mean ay nandito po siya. So this is the mean, nasa gitna. So kung titignan nyo po yung yellow, that would be the dispersion or the standard deviation. So ito po yung minus, ito po yung plus. Okay? Yan. So, yan po yung dispersion. Ibig sabihin po, yung lawak po ng distribution. Okay? So, we have also the correlational statistics. We have the chi-square, the Spearman-Rho, and the Pearson R. Okay? So, meron pong level din po yan. Kapag chi-square daw, we have a data which is nominal. Okay? Spearman-Rho, we have a data which is ordinal. Okay? Pearson R, we have the data which is interval or ratio. And we have the classification on the inferential statistics, which is parametric and non-parametric. So it's very important that we will going to determine the level of measurement na meron po ang dependent variable o yung confounding variables po natin. All right. So, Ma'am Oze have discussed already the different variables. So, we look into the dependent variable as level of measurement. So, our dependent variable is the variable being measured or the data or the one that is being scored. The change in the dependent variable is brought about by the independent variables. Okay? So, yun po. So, kapag continuous po yan, variables that take on any value such as wala pong hangganan. Okay? Kaya po siya continuous. Ano po yung continuous? Age. Okay? Yung discrete variables are variables that take on a small set of possible values. So, pwede po yan, merong hangganan yung variable na po iyon. Alright? So, when we look at statistics, this is the use to organize, summarize the information so that the researcher can see what happened in the research study and can communicate the result to others. So, we are using statistics to, one, to describe our population. Okay? Second is to make the assumption answerable. Okay? Or to conclude our hypothesis. Okay? So, yun po ang statistics po natin. So, it helps the researcher to answer the question that initiated the research by determining exactly what general conclusion are justified based on the specific result that were obtained. Of course, kapag dumating ka po sa punto ng results and discussion, sa result wala kang maintindihan. Wala tayong maintindihan kasi puro numbers and puro statistical language. Yan po yung problema po sa atin. Kaya po, sabi nga ni Ma'am OJ kanina, ayaw daw niya na sasabihin lang ng statistician, health sciences naman yan. Hindi sila nakakaintindi masyado ng statistics. No. Actually, dapat tayo nga po yung nakakaintindi, mas nakakaintindi pa po ng statistics. Bakit? Majority would be look into epidemiological studies, risk factors. So, dapat nakakaintindi po tayo. Hindi lang po mean, median, mode, standard deviation ang ating statistics. But we go beyond that, the inferential statistics. Alright? So, when we look at statistics, we look into variables, the dependent, okay, the controlled, and in mind, what is kept the same? May nagbago daw ba? Okay. What is being measured? What changes in the experiment? Kung we are gumagawa po tayo ng experimental research design. So, nagbago daw ba yung dependent variable? Okay. So, when we look at those questions, we have to make sure that we know the level of measurement or what type of data does the dependent variable or the confounding variables has. So we have the nominal data. It is the lower level of measurement. Nominal, it pertains to naming or labeling, such as your male, female, tall, short, ano pa ba? BSPT, BSOT, BS Pharma. Okay? So, ayun po. Ordinal are ranked variables in terms of the degree to which they possess a common characteristic. So, these are your interval between ranks are not equal. You could not determine. Example po natin sa PT practice would be your MMT. You do not know the difference between 1 and 2 or even 4 and 5. Baka po pwede po sa isang tao, 4 pa lang po niya yon. Dahil mas mahina siya compare sa nag-assess sa kanya. Baka yung binibigay niyang resistance ay hindi equal sa 4 and 5. Kaya nasabi niyang 4, maximum resistance siya. Eh yung PT na isa na nag-assess, nagbigay siya ng maximum resistance. Eh nag-gym siya, malakas. Tapos nag-giveaway siya yung isang pasyente. Kaya grinade niya as 4. Tama po ba? Pero yung isang PT hindi nag-gym. Nagbigay siya ng maximum resistance niya, kaya 5. Na kaya ng pasyente, kaya 5. Grenade niya as 5. Okay? So you do not know the difference between two variables, which is your 4 and 5. Okay? So another one would be your interval. It is the ranks variable based on the predetermined equal intervals. So does not have as actual 0 point. Okay? Wala daw absolute zero value. Okay? Such as your temperature. Bakit po? Yung 0 degrees Celsius, it might be convertible to 0 degrees to degrees Fahrenheit or to degrees Kelvin. Okay? So ratio is the rank variable based on equal interval or a true 0 point. So that's the highest level of measurement, and it is the example would be the scale of height and weight. Pero weight lang po ha. Ang tawag nito, kapag tao daw po ang height and weight, natutunan ko po to sa sa Doctor of Public Health. Kapag tao daw po ang height and weight, hindi daw po siya ratio. Nasa interval daw po siya. Kasi pag kamakanak daw nung tao, hindi naman daw siya zero weight at zero height, sabi nung professor ko ng statistics sa DRPH. Kaya parang nagkaroon ako ng itching of the mind again. Gusto kong i-research to yung sinabi niya. Nagulat na lang ako nung sinabi niyang ganon. So, sa tao daw, walang absolute zero value with regards to height and weight. Kasi pagkasilang, wala naman daw 0 centimeter. Sabi niya gano'n sa akin. Okay? Doctor of Medicine na po yun. Ewan ko po. Actually, hanggang ngayon, ang tawag nun, tumitingin ako ng literature about that. Okay, so we go on the descriptive statistics. It's merely collecting, organizing, summarizing, and presenting the data. Okay, numbers po ito. Your inferential statistics would make, kaya po siya tinawag na inferential, you are making inferences. Okay, sinasagot mo yung, yung explanatory, your deep. Except for the D, sinasagot po niya yung EEP. Okay? Hypothesis testing and determining relationship and making prediction. Okay? So kapag D sa deep, descriptive statistics. Kapag EEP, inferential statistics. Okay. So our measures of central tendency would be your descriptive statistics. What are these? This is your mean, median mode, standard deviation. So descriptive statistics are produced procedure used to summarize, okay, organize and make sense of a set of scores or observation. So descriptive statistics are typically presented graphically, in tabular form or in table, or as summary of statistic in a single value. So the data na ginagamit po natin are measures meant of or observation that are typically numeric. So the datum or the singular is a single measurement or observation was usually referred to as a score or raw score. Okay, so pero dito po sa example po natin, it is already summarized. Okay, so let's go to our example. Okay, so this is the effectiveness of the ultrasound therapy on myofascial pain syndrome of the upper trapezius. It's a randomized single-blind placebo-controlled study. Oh, okay, tignan nyo po yung nakabox. Okay. So, what are our confounding variables? So, ang ating pong first statement of the problem is, here is, what is the profile of the subject as to age, body mass index, sex, socioeconomic status, educational level, marital status, and analgesic use. So old school style, sasabihin ng mga old school people, what is the profile of the ultrasound group and the placebo group as to, yon. Pero sa IMRAD format, pwede po nating sabihin na what is the profile of the subjects. Okay. So, kung titignan nyo, ang ginamit niya po ay count, the N. So, ilan po ang participants na nasa ultrasound group? 27. Okay. Ilan po ang participants na nasa placebo group? 27 din. So this is normal in distribution. Magkaparehas po. So ang ginamit po niya is count. Okay? So ano po pag ito? So ito pong female and male, ito po ay anong klase po ng data? This is your naming, nominal. Socioeconomic, nominal. Okay? Educational level, nominal. Okay? Marital status, nominal. Okay? Analgesic use, pwede po yung nominal. Okay? So anong gagamitin po natin na statistics po dito sa nominal? The frequently occurring variable, which is your mode. Okay. Mode po ang gagamitin. Huwag po munang titingin sa right side sa P, dito muna sa nakabox. Okay? So, sa mode. So, ano naman po yung age? Body mass. O, ito po. Ayaw na ayaw po to ni Ma'am OJ. Tama po ba, Ma'am OJ? Ayaw na ayaw po niyang kinakategorize ang age. Okay? Bakit? Ang age po ay ratio na siya. Tapos, ang ginagawa ng old school, 0 to 4, ganon. 0 to 4, bumababa po yung level of measurement. Okay? Nagiging nominal po siya. Ratio na po siya eh. Pero, of course, sa epidemiological studies, that's also the reason why kinakategorize siya na 0 to 4 kasi tinitignan kung sino yung most frequently. Kaya po galing din po siguro yan yung hindi pinapalabas ang 0 to 10, hindi pinapalabas ang 65 or higher. Dahil po previous epidemiology po ng SARS ay ang mostly na naapektuhan ng SARS noon ay yung mga bata at matatanda, no? So, yun po. So, baka yun po yung rason. So, in epidemiological studies, ang ginagawa po natin, ginugroup po natin yung age group. Okay? Minsan. Okay? So, your body mass index is also your ratio data. Okay? So, this is the mean. So, ito po yung mean at ito po ang standard deviation. So, the mean average age of the participant in the experimental group is 29.8. And in the placebo is 31.1. Okay, the average age. Okay. The body mass index on the experimental group is 23.7 and in the placebo group is 24.5. Alright? So, yun po. So, wala po tayong example po dito na mode, median, but your median would be the median value. Okay? So, yung nasa gitnang value. Alright? So, ine-express din po yon sa parang pwede pong ganito ang pagkakapresent niya or pwede rin pong mean value. Okay? So, we go to your non-parametric statistics. Okay? Or your inferential statistics. Your inferential statistics is pwede po siyang non-parametric or parametric statistics. Sir, kailan po nagkakaroon ng gagamitin ang parametric and non-parametric? Ito po palagi ang sinasabi po sa amin, no? Kapag proposal, we go to the highest, which is your parametric muna. Kasi hindi pa po natin alam kung ano yung mangyayari later on. Hindi pa po na ma-determine kung normal yung distribution, kung homogeneous sila ng experimental group or control group. So, gagamit muna po tayo ng parametric statistics. So, t-test muna or ANOVA. Ayun. So, kapag dalawang group, siguro t-test, tapos kapag litong-lito ka na, mapapatanong mo sa sarili mo, ano ba? So, ANOVA po yun kasi madami ng group. Okay? So, non-parametric tests are specialized class hypothesis testing that you use when the assumptions for parametric tests are not being met. So what are the qualifications? So meron daw po talagang qualification kung ano ang gagamitin natin. No, kung gagamit daw ba tayo ng parametric test or the non-parametric. So ang parametric statistics po natin ay, sorry po parang I need to go back. Later na lang po. So, sa correlational statistics. So, sa parametric statistics, ang assumption po natin is normal ang distribution. Okay? So, a certain level of measurement which is interval or ratio ang data. O, ito na naman, old school style. Basta daw, dumating sa punto na madaming participants, greater than 30 is recommended per participants. Hindi pa ako nagsabi niyan Sinabi po yan no ng itong publication na to. I do not know kung saan pinagkukuha. Pero old school statistics po. Basta po daw dumating sa punto na more than 30 ang participants, pwede na daw pong parametric statistics. But of course, you have to look into kung normal ang distribution, homogeneous siya, kukomputin mo po iyon. An independence of observed except with paired data. Observation for the dependent variable have been randomly draw. O nagkaroon po siya ng random assignment. No? Equal variance among the sample population or parehas or comparable daw po sila. And the hypothesis usually made about numerical value, especially the mean, of course. So, yan. So, eto po. O, classify po natin. Ang example po natin. This is a test for homogeneity. Okay? When we look at this one, this is now your inferential statistics. Okay? So, when we look at homogeneity, sasabihin po natin, ano po yung isang assumption? Equal daw po ba? Comparable daw po ba? So, when we look at normality, normal po ang distribution. Okay? So 27 and 27. Basta ang n na po natin ay the n or the n here is not greater than or equal to 1.5. Okay. So kung this is only for ah, physical na tinitingnan. So, normality. Pero magko-compute pa rin po tayo ng normality, no? Ng distribution. Okay. So, kapag ang example po natin ito, 25, etong 27 na ito, 25 tapos 27 yan, the difference is 2. So, hindi na po normal. Okay? Kukomputin po natin iyon. Magko-compute tayo kung normal. Okay? Pero kung ito, normal na po ito. Masasabi natin normal because the group comparing the experimental group and the control group are already same number of participants. Okay? So, or kung 26 yan or 20 and then 27 po ito, normal pa rin po yun. Pero kapag nag-25 yung isa sa kanila, hindi na po normal. Okay. Paano ba po natin malalaman? Homogeneity. Comparable daw po ba sila at baseline? Yes. Why? Because the p-value, anong ibig sabihin po? 29.8 and 31.1. May pagkakaiba po? Yes, may pagkakaiba. 31 is greater than 29.8. Pero anong sabi ni mathematics, simple mathematics? Yes, may pagkakaiba sila. Pero anong sinabi ni statistics? Wala daw pagkakaiba. Bakit? There is no statistical significant difference between the placebo group and the ultrasound group with regards to their age. Walang pagkakaiba kasi yung p-value niya is greater than 0.05. 0.05. Yan yung titignan nyo. Kapag greater than yung greater than 0.05 ang p-value, there is no statistical difference. So ibig sabihin, comparable po yung ating mga participants as to their profile. Kasi po lahat po ng p-value, wala daw pong pagkakaiba. O tignan niyo po ito, perfect nga po ang socio-economic status. No? Good to moderate po. So wala pong purita sa kanila, no? Wala pong poor people, no? So lahat po sila daw ay greater than 1 nga po ito. 1 nga po ito. So match na match po sila. Okay? So sa experimental research design, meron po tayong tinatawag na matching din. But of course, some researcher would say even identical twins are not the same. Okay? Kaya po ang matching hindi minsan ginagawa sa health sciences. Ang ginagawa po, nagtetest po tayo talaga ng normality of distribution and homogeneity of the experimental group and the control group. Okay. So yun po. Ano po ang hypothesis natin dito? There is no significant difference between the experimental group and the control group. Okay. So, eto po, nalaman na po natin yung SOP number 1 which is to determine the profile of the subject. So, descriptive statistics po yon. Ngayon po, inferential na. Alright. When we look into homogeneity then, we look into the dependent variable. No, the dependent variable at baseline. So, titignan po natin. Ilan po yung dependent variable po nito? Pain, VAS, during rest and during activity. Okay? Algometer is the result. Algometer result. Okay? Palpable muscle spasm. Beck depletion inventory score. Yun po yung mga ginamit na outcome measures and the dependent variable. So kung titignan nyo po yung before treatment, before treatment, lahat po niyan ay greater than 0.05. So ibig sabihin po niyan, comparable po sila at baseline. So, ibig sabihin po, there is no statistical difference between the ultrasound group and the placebo group with regards to their BAS, with regards to their algometer, with regards to their palpable muscle spasm, and with regards to their Beck depression inventory scale. Therefore, mapagko-compare po natin sila. Equal po yung kanilang score during the pre-test. Okay? So, ayun po. So, when we look at this one, okay. So, equal sila. Equal sila. Okay? Parehas sila. Okay? Kuha po. Anong pong ginamit ng mga outcome measure po dito? VAS, palpation, Beck's depression inventory, and your short form 36. Okay. When we go further to the inferential statistics, so na-suffice na niya. So gagamit na po tayo ngayon ng parametric statistics. And that is your t-test. Okay? Kasi, bakit po t-test? Kasi po ang pinagko-compare niya, dalawang group lang po. Okay? So, the ultrasound group and the placebo group. Okay? Kuha po. At ang pinagko-compare lang po niya ay the before and the after treatment. So, pre-test and post-test. O, tingin muna tayo sa right side na p-value. Wag muna sa baba. Okay, tingnan nyo po. After the treatment, ang naging VAS po is 1.9 sa ultrasound group. Sa placebo group is 3.7. May difference? Yes. At ang sabi ni statistic, that is a statistical significant difference. Ibig sabihin po, mas maganda daw po yung pagbabago, okay, na napunta po sa ultrasound group compare sa placebo group. But wait, we look into the difference. Okay? Ano daw po iyon? Yung negative 3.5, minus po niya yan. 5.3 minus 1.9 equal to negative 3.4. Ibig sabihin po, yung pagbabago po na nasa ultrasound group ay 3.4. Ang pagbabago din po na nasa placebo group ay 1.6. Okay? Compare mo, 3.4 versus 1.6. So, ang mas madaming pagbabago po ay nasa ultrasound group. At yung pagbabago daw po na iyon ay statistically significant difference. So, we therefore conclude that ultrasound group decreases their visual analog scale. Therefore, ultrasound is an effective to decrease pain at rest. Ultrasound, go on. Ultrasound is an effective to decrease pain during activity. Ultrasound is an effective to improve algometer results. So baka po itong algometer po is the higher the better. So from 4.8 naging 7.4 at ang pagbabago po na iyon is 2.5. The difference. So ibig sabihin po nito ay effective. O tignan niyo po ito. Alright. Tignan niyo po. From 5.3 visual analog scale sa VAS, 5.3 naging 1.5. Yung pinag-confirm mo po yung 5.3 and 1.9 is statistical significant difference. O that this is your, anong sabi ni Ma'am OJ po kanina? This is your within the group. Pag kinompare mo naman po yung ultrasound group and placebo group, this is your between group. So etong slide po na to is between group, between ultrasound and placebo. So we can conclude that the ultrasound group improve, no? Improve po. Ayan. So when we go back, and when we go further, ayan po, the effect with each is the difference. Meron daw po talagang difference po yung statistical difference, ang mga difference before and after. Okay? Kuha. So yan po, naka-green. So yung p-value is effective. We can conclude that our independent variable, which is ultrasound, is effective. Let's go to your between. Okay? Between group. Okay. Ito po palpable muscle spasm degree. Tignan nyo po yung naging 1.1, nag-start po siya ng 1.1, naging 0.6 po siya. Ang difference po niya is 0.5. Ang p-value po natin ay less than 0.05. Effective? Yes, sa ultrasound group. Pero tignan nyo po ito. Effective din po siya. Okay? Sa p-value, hindi po tayo nagra-round off ha. Hindi po tayo nagra-round off. Okay. Effective din po siya. Pero tignan nyo po ito. Between groups on the Beck Depression Inventory Scale. Erase ko po. Saglit lang po. Okay. Ano po ang masasabi po natin dito? Mako-conclude po natin. Ibig sabihin daw po, wala pong pagbabago. Okay? Parehas lang daw po ng pagbabago ang Black Depression Inventory Scale sa ultrasound at sa placebo group. Kuha po? Yes. So wala pong superior sa kanila. Meron pong pagbabago na naganap pero wala pong superior sa kanila. So ibig sabihin, ultrasound is not superior than the placebo. Okay. With regards to the Beck Depression Inventory Score. Okay po? Ayan. So we can conclude that ultrasound can reduce pain at rest and activity. It can improve algometer result. It can improve palpable muscle spasm. Okay. Kuha po. Ngayon po, we can conclude sa placebo group kasi malamang hindi naman po nag-apply ng ultrasound group sa placebo. O di kaya po nagbigay po ng ultrasound pero hindi naka-on yung machine. Tama po ba? So we can conclude na placebo. So merong psychological effect na kapag nag-a-apply ka talaga ng ultrasound, nag-i-improve, no? Kuha po. So eto. Pero pagdating po nung pagdating po ng Beck Depression Inventory Score, mako-conclude din po natin na walang pagbabago, walang superior po sa kanila. Okay? Kuha po. And I think we go back to, that is our inferential statistics. When we go back to allow me to go back to my slide sa relationship naman po tayo. So, sabi po natin, what is the relationship of the confounding variables or the profile with the regards to the dependent variable? Alright. So, ito po yon. Tingnan po natin. So, ano po yung magiging hypothesis po natin dito? There is no significant correlation between VAS and the profile of the subject. There is no significant difference between a significant correlation between the profile of the subject and the algometer result. Pwede pong ganon. Okay. So, meron po tayong tinatawag na positive correlation. So, as the age increases, pain also increases. Or the other way around. As age increases, pain decreases. Pwede pong ganon. Okay? Basta titignan po natin kung sino po yung ano po yung direction, ano po yung numero. Kasi po ang numero, malalaman po natin yan. Kung strong, moderate, or low. Saan po ito? Weak. Okay? So, makikita po natin sa correlation table, correlation coefficient table. at least 0.8 to 1, that is a very strong relationship. Ibig sabihin po, mataas po yung relasyon nila. Okay? And 0.6 up to 0.8 is moderate strong. 0.3 to 0.5 is fair. Less than 0.3 is poor. And when you look at this one, no relationship. But of course, you have to look at po, these are only R value. Yung relasyon daw po ba na iyan ay strong, but you have to look at also the P value, which is the trueness of that particular relationship. So, kapag relationship po ang tinitingnan po natin is R value and the P value. Of course, ano po ang masasabi po ninyo dito? Okay. Example po natin. O, pain and ano? Pain and age. So, as age, there is a strong positive relationship between age and visual analog scale, or pain and age, and that is statistically significant. So as age goes up, pain also goes up. Okay? So yun po. So kung pain and ano po ang ating example. So kung titignan po natin, yan. So pwede po na ganyan. So pataas. So there is a pataas po yung relationship. So 0.8. So dito po tayo magbe-base doon sa table po na pinakita ko po. Okay? So sa ano po kasi kay Mustafa et al, hindi po nila kinuha po yung relationship ng confounding variable. So this is your confounding variable and the dependent variable. Okay? So correlation. So to the inferential statistics po, to summarize po, ito po yung sinasabi po ni Ma'am Oji kanina. If there is a violation of the parametric statistics, meron po siyang counterpart, which is your Mann-Whitney, okay, Wilcoxon, one-way ANOVA, is a parametric statistics. Ang counterpart po niya is Friedman and Cruz-Calwalis. So, yan po yung gagamitin po natin kapag may violation po doon sa criteria on inferential statistics, which is ito po yung titignan po natin. Pero in a human sense po, based po dito sa napag-aralan po natin today, meron lamang po tatlo. Pwede pong tatlo. Ang data po na meron ay interval or ratio. Normal ang distribution. Nag-undergo po siya ng nag-undergo po siya ng random assignment. So any violation of the three, pwede po na po tayong gumamit ng non-parametric statistics. Okay? So to summarize my lecture for today, I hope I could deeply explain statistics when we meet each other in our session. So data analysis, ito po yun. So it's very important to determine what type of data we have for the dependent variable and the confounding variable. Okay? So ayan po. And how many groups ang meron po tayo? Kung one group lang po siya or two groups. Okay? And these are your statistical analysis. For the descriptive statistics, we are only using measures of central tendency, which is your mean, median mode, standard deviation. Sa parametric statistics, dalawa lang po yan. Pag kinompare nyo po between groups, dalawang group, t-test. Pag pinag-compare po, post-test and pre-test, t-test. Pero kapag tatlo na independent variable, tatlong group, malilito ka na talaga at mapapatanong ka, ANOVA. ANOVA. So, ANOVA po iyon. Okay? Sa relationship, okay, sa correlation, we use Pearson product moment correlation. for interval or ratio. Ordinal for Spearman-Rho and chi-square sa nominal. Of course po sa chi-square po wala pong R. Sasabihin lang po niya no R. Ang sasabihin lang po niya is P. May association po sila. Okay? So I think that's the end of my lecture and these are my references. I hope you learn kahit basic po ng statistics. Okay? So yesterday, I talked to La Consolacion University, Philippines for the basic research ethics principles. Okay. So we are now ready to entertain question po. Sir Richard.
Hello. Thank you, Sir Gerald and Ma'am Odette. So anyway, open forum po tayo for like 15 minutes. Would that be enough? May clarifications, questions sa mga natitira pang 22 participants. Mga 19. Not really. O, tama. So I hope you see the connection now between the basic EBP and the advanced EBP. No? Ayan. So most of the participants today were participants of the December 13 and 20 session. So walang tanong, mga source and ma'am. So yung worksheet po nila ma'am is nasa Google Classroom, no?
I-share mo po ata siya, sir, kasi hindi ko na-share doon sa ang tawag doon. Bale tayong tatlo, ay tayong 4, 5, yung owners ata. And then let's have them answer the the activity sheet. Okay.
Meron na din pa akong in-upload, sir. Activity sheet number 2. Nature of statistics and level of measurement. Ma'am OJ, di ba one lang po sa isang activity sheet lang?
Oo, activity sheet 1 pero may ABC keme, parang gano'n. Isang activity lang yon, lahat ng activities within the discussion. Kung ano yung nakita nila sa PowerPoint, hindi po yung nakalagay. May group lang. Okay, if you want to do it individually, pwede rin naman. Kasi yung iba ata hindi na-download yung journal article before the presentation today. Okay.
Okay, ma'am. So I think now they will just submit it sa Google Classroom. Yes. So kaya submit sa Google Classroom. And para asynchronous na lang yung gagawin nyo. So afterwards, no, we will, after submitting your worksheets, we will give you the certificate for this basic EBP and statistic course.
Sige sir, update ko na lang. Update ko pala yung yung activity worksheets nila for the first session para mag-identify din sila ng statistical test para meron pong ang tawag dito, meron pong continuation yung talk ni Sir Jet dun sa statement of the problem tsaka hypothesis ng ang tawag dito first session. So update ko po yung activity sheet.
Tapos ma'am, individual na lang po sila.
Oo, individual na lang. So wala nang group.
Yes.
Okay, sige po. Sir, sa class C, wala po yung activity sheet.
Isang classroom na lang po tayo, sir.
Ay, oo, Sir Dom. May isa pong bago, Sir Dom. Yung for this, di ba, for this webinar, may isa lang pong isang
baka hindi pa po
lang
in-accept.
Oo.
Isa lang yung
pakidagdag nyo lang. Oo, isang classroom lang tayo ngayon for the free seminar. Okay.
Okay, so thank you to our benevolent speakers. I hope to see you again our next second run. So for those who haven't attended yet, the Advanced EBP's webinar, please join. Yes, Sir Neong, ay nag-clap yata si Sir Rene. So wala na po tayong question para walang question. So anyway, ayan. So goodbye po everybody. Salamat sa pag-attend.
Sir Richard,
Ha?
mag-stay tayo.
We'll post po yung recording.
Mag-stay tayo, Sir Richard. Sir Taito, Sir Bernard, Ma'am Odette, Swan Lake, paputol-putol ba?
Hindi naman.
Thank you po.
You may leave po yung mga nandyan pa. Mag-meeting lang po kami. Thank you.
Tanggalin mo na, sir.
Baka nakatulog ang may ite.
Salbahe, nang kick out. Nang kick out, bad.
Ayan, wala na sila.
Ayan,
Sorry.
tayo-tayo na lang.
Sir Richard, ha? Nagmamadali ka na naman. May date ka na naman.
Inggit ka, Sir Jeff.
Ano sabihin mo?
Wala lang. Hindi, kasi si Ma'am Oji napaka-comprehensive na yung discussion niya.
Dapat pala natin yung output natin para dun sa STAT may continuation based on sa tanong nila sa SOP tsaka sa hypothesis, no?
Oo nga, Ma'am. Ngayon ko lang din na-realize.
Oo, pwede pala nating i-cross na ganun.
Oo.
No?
Ma'am?
Ko na lang yung sa activity sheet nila.
Apo.
Ginamit ko yung Zoom ng UP. Pwede pala. Kasi di ba may Zoom ako ng UP, ng UP.edu.
Oo.
May sense pala yun. Free. Kahit wala na ako sa UP. Ikaw, Ma'am Odette, may UP.edu ka pa?
Hindi ko naabutan.
Ay, sayang.
Hindi ko na naabutan yung
Wala pang G Suite account noon.
Ay, grabe. Meron naman na yan. Hindi lang offered. Hindi kasi in-offer nila yan dun sa mga nag-online na. Di ba kasi nagsimula na yung MPT na online. Sina Sir Gerald may ganyan eh. Kasi
Grabe
sila.
Sir Richard, pagbabayarin ka niya.
Hindi naman siguro.
Hindi. Basta UP.edu, binayaran na ng school yan. Basta may email ka ng ganon. UP.edu.page. Yung sa FEU, hindi ko pwedeng gamitin kasi baka makita nila.
Yung Phil Australia, nag-leave ka na. Nag-unsubscribe ka na.
Mahal.
700 lang naman, kaya mo yan.
Hindi gaga. Hindi 700 yun.
Yung subscription, $14.99 lang yan, ha?
Zoom yan. Zoom.
Kaya nga Zoom.
Nakasubscribe naman ako sa Zoom, yung Phil Australian na email. Yung sa akin.
Ma'am OJ, paano yung ginawa mo dyan sa background?
Secret. Yung sinabi ni Sir, yung sinabi ni Sir Chard.
Mag-upload ka sa Zoom account
Pero kailangan dapat may green na background ka muna.
Okay. Ma'am, sir. Ma'am OJ, for marketing purposes, mag-free tayo ulit, February?
Okay lang. Same lang naman din, di ba? Wala
Ito?
Oo.
Hindi, yung na lang, recording na lang, na lang natin. Yun na lang panoorin nila. Yung recorded.
Ay, ganon.
Oo.
Paano kung may tanong sila?
Mag-post sa lang na, ma'am, sa na lang. Through Google Classroom.
Okay.
Di ba? Para asynchronous na. Para it's available para pwede nilang balik-balikan.
Okay, sige.
O meron ng ano, meron ng
Para hindi kayo mapagod lecture.
Oo nga. O may registrant lang for the second run?
May 3.
Okay.
So meron na
Mas
sa...
ma-appreciate na nila yan kasi mataas ang mataas ang CPD.
Kaya nga ang taas ng units. Ewan ko
Bakit magtaas? Siguro nagbigay ka sa nag-evaluate.
Hindi yung yata, yung asynchronous nagpataas. Pwede pala yun. Alam na natin.
Oo, tapos pinapagalitan mo ko sa asynchronous na iyan.
O siya, may gagawin pa kayo?
Okay.
Nagmamadali ka na naman.
Bye! I-evict na kita, Rebo.
Bye-bye po.
Bye-bye. Bye, Ma'am OJ.
Bye po.
Thank you, partner. Titus.
See you soon.
Hi, Ma'am OJ. Bye-bye.